senhores, é um prazer tê-los conosco na primeira Conferência Internacional de Promoção da Atividade Física na Saúde Pública. A gente deseja que todos sejam muito bem-vindos.
In public health, physical activity in public health. You're all welcome to this great event. The regular practice of physical activity adds up to treating chronic diseases, non-transmittable diseases, cardiac diseases, high blood pressure, diabetes, breast cancer, and colon, as well as contributing to reduce symptoms of many depression and anxiety. Physical activity assists in preventing and reducing the excessive weight and obesity and to promote health, adding up to the best quality of life and the welfare and well-being of people. The WHO is pointing out the need for the countries to develop integrated approach to increase levels of physical activity in population, including actions to create active environments, because an active physical inactivity is related to other factors like social inequality and economical inequalities. Considering the recommendations of the WHO and the potential of the exchange of experiences, international experiences and national experiences, contributing to develop integrated approaches in order to increase the level of physical activities in the countries, we consider it is of utmost importance to hold this event to promote sharing of technical and scientific information on the advances and challenges to promote physical activity in public health. We will have 2 days event. We're beginning today, and the next day we'll have the opening session and a talk with Dr. Juana from the WHO. And then we'll be having the international experiences session. And today we'll be having the presence of Brazil, Portugal, Uruguay, Argentina, and Peru. On the second day, we'll be having 2 initial talks. First one is the release of the document Public Policies on Physical Activity, Analysis and Governmental Documents, Dr. Gisela Minato. Next up, the talk relation between promoting physical activities and the goals of the Sustainable Development Goals with Leandro Garcia. Tomorrow we'll be having international experiences by Costa Rica, Paraguay, Chile, Colombia, Jamaica, and Ecuador. I'd like to remind you, all the speakers, that the certificates after this event will be able to be generated in our website of the event. Wish you all a great event where we, in these 2 days, to debate and to learn more how to promote physical activity. So without further ado, we'll be having this opening ceremony session. Juliana Mera da Silva, Director of the Department of the Secretary of Primary Attention of the Ministry of Health in Brazil. Also, Rafa Câmara Medeiros Parente, Secretariat of Primary Attention of the Ministry of Health in Brazil. And also, Salmo Hendes, Director of the Department of Non-Transmissible Diseases and Mental Health of the PAHO and the OMS. At this moment, I'd like to pass the floor over to the opening words, Juliana Rezende Melo da Silva, Director of the Primary Attention Secretary of the Ministry of Health in Brazil. Good morning, Juliana. Good morning, Danielle. Thank you. Hello. We are very happy for this opportunity in conducting this first international conference in promoting physical activity in public health, and under general coordination of physical activities together with the Department of Health Promotion and Primary Attention Secretariat is here gathering together 11 countries of Latin America and Europe and representatives from PAHO and the WHO to discuss and debate the importance of physical activity for the population, for the health population. So I'd like to thank you everyone for attending this conference. We no doubt we have great benefits for physical activities. Yet it is very alarming the great number of population who do not meet the requirements of uh, holding activities, and they are sedentarism. So our main goal is to diffuse, disseminate, and implement in primary care on health in the Health Unified System of Brazil, SUS. The Ministry of Health recognizes physical activity as a determinant in health, including physical activity in basic attention and the national attention on promoting health. Brazil has a number of successful initiatives in this field. I'd like to highlight three of them. Academias da Saúde program, promoting health through 8 axes. The main of one of them, physical activity, and is counting on 1,716 units accredited with a 51 reais. The for primary health in this year with a goal of broadening the offering physical activities in the primary care of Brazil. Today are being accredited 8,270 health, uh, going over a total of 48 million reais in 2022. And extremely strategic as well, but not least important in 2021, the release of the first Brazilian guidelines on physical activity through the guide a handbook of physical activity for the Brazilian population in Portuguese, English, audiobook, and also in sign language. This is the first document in sign language in the history of the Ministry of Health. So in this way, Department to Promote Health of the Secretary of Primary Attention and Health of the Ministry of Brazil points out the importance of this event to promote physical activity and public health. We hope that the actions in a national and international setting may be more and more strengthened. And the goal of that is to form the creation of systems, environments, and society more active and healthy people, reminding that practicing any physical activity in time and place available is better than not to practice any activity. Thank you. I wish you all a great event and exchange of experiences. Thank you, Juliana, for your talk. And I'd like to invite now Dr. Rafael Câmara Medeiros Parente, Secretary of Primary Health of the Ministry of Health of Brazil. Good morning, Rafael. I'd like to invite Juliana to promote health, also the coordination, physical activity, Fabiana, Dr. Anselm from PAHOL, everyone present, all countries mentioned. I receive you with much joy. Representatives of the Ministry of Health. First speaker, Dr. Juana, who will be speaking on perspectives to promote physical activity. WHO, United Nations, sorry, the UN. I've been there representing the Ministry of Health in Geneva on social discrimination, maternal mortality. We are here today in this conference with great care by the department and by the coordination. I'd like to thank representatives of each country. This event points out the importance that the Ministry of Health of Brazil gives to promote physical activity in public health, SUS, as well as spreading and visualizing possibilities to implement public policies in the health unified system. In this regard, the Ministry of Health and primary attention reinforces commitments to foster physical activities to all the Brazilian population. Such actions aim at reducing the high rates of physical inactivity in Brazil and around the world, which are considered a severe problem in public health in the global environment, to prevent the chronic diseases and transmissible, as well as improving quality and welfare of people. In this way, Department and General Coordination to promote physical activity constantly is working to strengthen the physical activity all over Brazil. Now, establishing this partnership in international arena, the goal is together with several experiences presented today and also tomorrow, be a promising way to promote health and physical activity in public health, in global public health. Juliana pointed out, our priority in physical activity is not expressed in just chit chats, but in numbers, in policies. We have more than 200 million reais in today allocating this, having professionals on physical health and primary care in UPS. This was a commitment of campaign of our President Bolsonaro, and it was conducted by us. Besides of promoting physical activity to the population, primary care this also gives jobs to millions and millions of physical education teachers. We never had that in the history of Brazil, as well as we are releasing the handbook of physical activity by the best experts in the field, serving today as a benchmark to the population, always focusing on the population, not assessing corporativism. So here, I hope that we have a great day of work. Unfortunately, not be able to stay. We will be holding our event. I'm a doctor, a gynecologist. Marcelo Queiroga, Minister of Health, who also supported this cause of physical activity. With me in Copacabana, he launched this policy. We have an event on our government in terms of maternal and infant mortality, but a director will be here representing us. I hope you had a great day of work for everyone. We're releasing this policy all over Brazil, fostering this policy of physical activity. I'll be briefly in Porto Alegre. This will be the state that I'll be able to be there. Our team will go in all the federations of Brazil to launch the policy showing the priority for us on physical activity. Thank you very much. Have a great event, everyone. Thank you, Dr. Rafael, for your words. And it's a great pleasure now to invite Dr. Anselmo Renes, Director of the Non-Transmissible Diseases and Mental Health from the PAHO. From PAHO. Good morning, Dr. Anselmo.
Thank you so very much. So distinguished representatives from member states, colleagues, honorable ladies and gentlemen, good day and welcome. And I'd like to extend a special greeting to the colleagues from the Brazilian Ministry of Health, Dr. Rafael Parente, Secretary of Primary Health Care, and Juliana Rezende, Director of the Health Promotion Department. I appreciate the presence of everyone who's participating in this first international conference on promotion of physical activity in public health, especially the country representatives and our panelists. I congratulate the Brazilian Ministry of Health, in particular, the General Coordination for the Promotion of Physical Activity, for its efforts to expand cooperation and strengthen physical activity, especially in primary health care. We know, as we heard before, that physical inactivity can lead to heart disease, obesity, diabetes, and other non-communicable diseases, as well as specific cancers. The region of the Americas is the least physically active of all the WHO regions, with 39% of the adult population not meeting the WHO recommendation of a minimum of 150 minutes of moderate intensity activity every week for adults, and 81% of adolescents aged 11 to 17 years not meeting the minimum of 60 minutes of moderate to vigorous intensity activity daily. One of the reasons we're lagging behind is due to the lack of policies. The region of the Americas is the region with the lowest number of countries with policies on physical activity that are actually in effect. The Global Status Report on Physical Activity 2022, published by the World Health Organization last month, highlights that the health cost to governments will be $27 billion a year, that is 27 billion US dollars a year, if urgent measures are not taken to encourage people to exercise more. Out of 194 countries, fewer than 50% of countries have a national physical activity policy, and only 30% of nations have national physical activity guidelines for all age groups. While nearly all states have reported a system to monitor physical activity in adults, only 75% of countries have such policies for adolescents, and fewer than 30% have such policies for children aged less than 5 years. In the area of policies to encourage active and sustainable transport, just over 40% of nations have road design standards that make walking and cycling safer. Progress has been slow. Governments need to accelerate the development and implementation of policies to increase the levels of physical activity and thereby prevent disease and reduce the burden on our already overstretched health systems. The news is, however, not all negative. We have also seen advances. Countries in the region of the Americas have been adopting important measures, such as the incentive for physical activity in primary health care, established by the Ministry of Health of Brazil this year, and a physical activity guide for the Brazilian population, as you have heard, that includes all age groups. Ministries of Education and Health have joined forces through an Inter-American policy program facilitated by PAHO and the OAS to strengthen the efforts of health and education in expanding and improving opportunities and capacities for school communities to be more active in the region of the Americas. Undoubtedly, this conference will contribute to expanding the cooperation between countries to strengthen actions to promote physical activity in public health, with emphasis on primary health care. By facilitating knowledge exchange about international and national recommendations for the promotion of physical activity, by encouraging the debate and identification of effective strategies to promote physical activity in primary health care, by mobilizing focal points in the ministries of health of countries to articulate a network to strengthen, promote, and support physical activity with leadership from the health sector, by identifying advancements and challenges of the physical activity agenda in primary healthcare worldwide, by encouraging dialogue on how current global issues impact on the primary healthcare work, and in particular on physical activity actions. And finally, by building consensus and committing to support and strengthen actions to promote physical activity in public health with an emphasis on primary healthcare. I wish everyone an excellent conference with much engagement and interaction and sharing of ideas and lessons learned. PAHO-WHO continues to work with member states to achieve more active and healthy populations without leaving anyone behind. Thank you so much for inviting me to join this opening panel, and best wishes to all.
Muito obrigado, Dr. Sam.
Well, thank you, Dr. Hennis, for your presence here, for your speech. And we are now closing the opening statement. So we thank again our director, Juliana Rezende, Dr. Medeiros, and also Dr. Hennis representing the Pan American Health Organization. So right now, we are going to start our opening remarks, our opening speech. We are going to invite Joanna Willemsen now. She is a doctor, and she's also an official technician in the World Health Organization in the Department of Promotion of Health. So her current work is concentrating on policies to promote physical activity and the development of tools, technical tools, that is, to support the implementation of that in the countries. She has coordinated the development of the first guideline from the WHO about physical activity, sedentary behavior, and sleep for children under the age of 5. And she has also worked with the update of the guide for physical activity and sedentary behavior for children, adults in 2020. So it is a joy and a pleasure to have her here. We are going to introduce the lecture about the perspectives of promotion of physical activity in public health, Dr. Joanna Willemsen. Joanna, you have the floor. Welcome.
Thank you very much, Daniel, and thank you very much to the whole group assembled here. It's great to see so many member states represented, and I particularly thank the Brazilian Ministry of Health for making this opportunity available to us to share some of this information. I'm just going to share some slides with you and just take you through some of the work that has been ongoing to promote physical activity within public health. And as Anselm quite rightly mentioned in his opening remarks, more than a quarter of adults are not doing enough physical activity to reap the health benefits that are available. And in the region of Latin America, this is even worse and a much higher rate of physical inactivity. What's particularly concerning is that that rate of inactivity is even higher amongst women and girls, and that 4 out of 5 adolescents around the globe are not getting enough physical activity for their health, which is probably going to continue into adulthood with the consequences on those non-communicable diseases that we're all so familiar with. And it's because of this that WHO headquarters in Geneva developed a global action plan on physical activity to span the period from 2018 through to the end of these SDGs in 2030, and set a target that all member states signed up to in a resolution that we would improve levels of physical activity by 15% by 2030, with a perspective of doing that through the implementation of key policy actions across 4 different areas. And these are summarized here, that we would create active societies through communications and training that will help to shift knowledge, values, and motivate behavior change. But we also need to have access to safe spaces and places where people can be active. So through improving infrastructure for walking and cycling, ensuring everyone has access to public open space, to sport and recreation facilities where they can be active. We also need to provide programs to support people to be active and increase those opportunities. And there the work focuses on a number of key settings, one of which is the healthcare system. So we can really engage those who are least active and support them to become more active. But none of those policy actions will be possible without strengthening leadership, governance, and partnership, and ensuring that we have the systems in place to support each of those. But it's also important to remember that these things do not work in silos on their own, that all of these activities and actions interact with each other. And it's only when we look at the entire system, the whole system approach, that we're going to be able to move physical activity forward. Physical activity doesn't fall just within the health system. It is really important to consider those other sectors that we need to bring along with us if we are going to make true impact. And that includes education, transport, urban planning, a number of different sectors that are really key and that all have their contributions to make to an overall more active system. However, we know that we need to accelerate action. We have some data on physical inactivity levels over the last few years. And although the rate for men in the yellowy green line you'll see here has gone down slightly over the last few years, in some regions more than in others, the rate for women, if anything, is actually increasing, that line in blue. And the dotted lines show us two alternative pathways going forward. We have either business as usual with no particular change and no improvement in physical activity levels, or we can have accelerated action, which is what we need if we're to meet that 15% improvement target by 2030. So how do we get more people more active for their health and well-being and to achieve that target going forward? Because we're focusing particularly on the health system in this conference today, I'm just going to pick out a couple of the potential policy actions that are particularly related to the health system and the health sector in general. And these are recommended cost-effective interventions for the prevention and control of NCDs. And this is an analysis of the costs and the benefits that are achieved by certain interventions that's currently being updated. So there will soon be a new document to outline all of these. But currently, all countries are recommended to implement population-wide public education and awareness campaigns that use mass media to promote physical activity. But a really important element of those is also to link with community-based opportunities and environmental improvements. So we're not just changing people's knowledge about physical activity, their attitude towards it, but also indicating where they have opportunities to become more physically active, to actually facilitate their behavior change. And a second really important cost-effective intervention is to provide physical activity counselling and referral as part of routine primary healthcare. And that's through a brief intervention that can be delivered by a number of different healthcare workers in any health setting. 4 years down the line from the publication of the Global Action Plan on Physical Activity, again, as Dr. Ansel mentioned, we have just conducted an analysis of where countries are at, a status report of physical activity and the implementation of those policy actions that were outlined in the Global Action Plan. And this was published last month, and the story is maybe not quite as good as we would have hoped, given that we're not far from 2030. I think it does indicate that we still have quite a lot to do and that we need to accelerate our actions if we're to reach those targets. And in summary, we looked across 29 different indicators, and the percentage of countries that were meeting those indicators, mostly assessed by a non-communicable disease country capacity survey that was conducted in 2021. And we also looked at indicators from the Global Road Safety Survey from 2018. And that particularly refers to some of those environmental changes that we know are so important to enable people to be active. So ensuring that roads are safe and that there is safe walking and cycling opportunities for people. And the results are not what I think we would all hope for. There are only 2 policy indicators where more than 3/4 of all countries are actually achieving that indicator. And for 18 indicators, it's less than half of countries that are reporting achieving that policy indicator. So I'm just going to take you through a brief summary of some of those indicators. I won't go into all of them, but everything is available on the WHO website. So going back to the important cost-effective intervention that I mentioned earlier, we see that only just over half of countries report having conducted at least one communication campaign on physical activity in the last 2 years. And that is a decline since 2019. Now, I'm sure none of us have forgotten that the years 2020, 2021, many of us were restricted in terms of what we were able to do due to the global coronavirus pandemic. And it is possible that countries diverted some of those activities on communication from physical activity to some of the pandemic issues. But COVID also showed us how important physical activity is for our physical as well as our mental health. And indeed, there were many countries that did put a particular emphasis on communicating about the importance of staying active, whether it's indoors, if we're in lockdown, or in restricted outdoor activities, if those were possible at the time, because they really realized the importance of ensuring that everyone remained as active as possible. And I think we need to recognize that and build on that going forward. We also saw that just over half of countries reported holding at least one free mass participation event around physical activity in those last 2 years. And again, those may have been restricted because of the pandemic in the last couple of years. But focusing on those policy actions to support programs to get people more active, I've circled here or put the square around the question that specifically asks countries if they use a brief intervention to speak to patients about physical activity within primary healthcare. The way the question is framed is whether they have a national protocol for the management of physical activity in primary healthcare. And only 40% of countries around the world answered yes. Even fewer indicated that this also had access to a referral mechanism for people who needed further support to be active. And even fewer had scaled this intervention to more than 50% of their primary healthcare clinics. So really the overall reach of this brief intervention on physical activity is really very low. And this is an area in which we can particularly intervene to improve that. I've also just briefly summarized some of the other activities that were assessed within these indicators, and it's programs that may be delivered in lots of different settings, such as childcare settings, workplaces, programs to older adults, programs that promote physical activity in public open spaces, including parks. And we see that generally the picture is less than half and sometimes less than a third of countries actually implementing these types of policies. In terms of active environments, and these are the supportive environments where people can be active, about 40% of countries have national policies that encourage walking and cycling, or that ensure that design standards address 3 key road safety criteria to make sure that pedestrians and cyclists are protected, particularly from using the management of speed and providing separated facilities to protect them from motorized traffic. Many countries do have national legislation that address some of the key road user behaviors, such as speeding, alcohol use while driving, mobile phone and drug use. But relatively few of those are actually applying those to the best practice that is available. So again, there is work to be done in ensuring that the environments where people can be active are actually safe and conducive to physical activity. But as I mentioned earlier, none of those policy actions will be possible without the support of the policy system. So this is data on countries that have a standalone national physical activity policy, strategy, or action plan that specifically addresses physical activity, as opposed to just having it only incorporated within an NCD plan. As Ansel mentioned, there are few countries that have guidelines for physical activity in all age groups, including children under 5. Although many countries do have targets and do have surveillance, we do in particular with the surveillance issue see that many countries haven't had recent surveys of physical activity prevalence in their population. So some of the data that they are relying on is really quite old, often more than 5 years old, sometimes more than 10 years old. So they're not able to really track the progress that is being made. And why does all this matter? This all matters for, obviously, we all want to improve physical activity because we want to improve health, but we also now have a new estimate of how much this inaction on physical activity is costing the public health system. And we're estimating that there will be 500 million new cases of preventable NCDs and mental health conditions if we don't do anything to improve physical activity between now and 2030. And this is going to cost $300 billion across that time period. So it's a high burden of preventable NCDs and a high cost burden just for those new cases. And that's just looking at the cost of diagnosing and addressing those cases for the first year. And in a few weeks' time, we'll be having a webinar specifically looking at the analysis that went into these estimates and going into more detail of the methods that we used for this. So the Global Status Report comes up with 5 recommendations given the status of policy implementation that we see now. And I've summarized these here that we really need to strengthen that ownership and the political leadership that is so essential for ensuring policies are in place and that they are implemented. That it's important to integrate physical activity into all these relevant policies, and in particular to support implementation with tools and guidance. And I'll speak a little bit more to that in a moment. Those partnerships are really important. Engaging the community and building capacity will be key in order to build that workforce and build that advocacy for physical activity. We also need to improve our data monitoring, having systems in place that provide up-to-date data to allow monitoring and to allow us to create that cycle of policy evaluation so we know how our policies are working and how they're being rolled out. But for all of that, we need to secure and align funding so that those national policy commitments can be implemented and really put in place. This is just a summary of the resources available if you want more detail on the Global Status Report. And what may be particularly interesting and available on our website are individual country profiles that summarize the responses to those surveys, to each of those indicators that I've spoken about. And those are available on the website to download. Going back to one of those recommendations that I mentioned earlier, I just wanted to let you know what WHO is doing to try and provide some of that technical guidance and tools that will help support policy development and implementation. And on the left, you see the global status report. And we have the 2 guidelines that were mentioned earlier that we've recently published and updated. And then to the right, we have a number of different tools that are now available. And this is a package of tools that we are continuously building to really support country implementation. And they're known as the active technical package and sets of tools. So we have tools for promoting physical activity as well as healthy diets through early childhood education and care settings, and physical activity promotion through schools. A toolkit for promoting physical activity through primary healthcare that I will go into a little bit more detail about, as well as in the pipelines to be published soon, toolkits on walking and cycling, on promotion of physical activity to older adults, and best practice for developing communication campaigns that will really promote physical activity to the population in general. We also have Be Healthy, Be Mobile, an M-Active tool. This is an SMS program that can be delivered through mobile phones, particularly targeting least active people and in general also older adults, to increase walking as part of a way of getting more physical activity. And those guidance tools are developed through a particular process to ensure that they are evidence-based, that they provide decision makers with the key components for any of those policies, the key elements that will that can be put in place in different settings or through different sectors. They provide detail of the development and the implementation guidance and case studies so that countries can see what other countries may have done on that particular topic, and also discuss the enabling factors, which are so important to ensure that policies are implemented and then sustained going forward. And for the toolkit on primary healthcare, the key elements, the key components that we focused on is a brief intervention that's based on the 5 A's model for behavior change, and really looks at how healthcare workers can assess a person's current level of physical activity, and if they have any contraindications to increasing activity levels, advise them on what types and amounts of physical activity they could be doing to improve their health status, work with them to agree a realistic goal, and assist them by connecting them with community opportunities to be more active. This is a really important element as we know that behavior change can be very complex and challenging, and it's often much easier when you're supported by family, friends, or you join in with a community opportunity that will support you through that change process. And the last A is to arrange follow-up, so to ensure that this conversation continues every time somebody attends a healthcare setting. But in order to do that, we need to have those enabling factors in place to support that healthcare worker. So to ensure that the leadership and the financing is there, that this is an activity that is valued and given sufficient time allocation to. Have to have the advocacy and the promotion so that everybody is on board with this. To develop some of those task sharing and team-based care initiatives to support the entire health system to address this issue together. Obviously, we need to have those community links and programs in place, and to ensure that each healthcare provider knows where to refer their patients to. The training will be key to develop those counselling skills and to make sure that healthcare workers feel enabled and well trained to provide this information. Patient information systems will be really important to ensure that continuity of care and the continuity of that support for physical activity in particular. And then obviously monitoring and evaluation are key to ensuring that this is all sustained going forward. We're currently developing a course that will be delivered through the WHO Academy. And the Academy is something that has been established very recently by WHO, and it will provide free online self-led learning courses that can be accessed by anyone. And the course that we are developing brings together 4 key NCD risk factors. So physical inactivity, unhealthy diets, harmful use of alcohol and tobacco use, because we have common ways of counseling patients through a brief intervention for each of these risk factors. And so we're building on them, acknowledging that many patients will have many of the risk factors potentially at the same time. And so to approach it through an integrated approach to ensure that those issues are tackled and support is given for behavior change. And we're hoping that that course will be available hopefully within the first quarter of 2023. We're currently just in the phase of actually using the very interesting design so that it's attractive for adult learning, and we'll hope it will be available very soon. So just to conclude, and a little aware of the time, I think we still need to do more, and we need to communicate better about physical activity so that people see the opportunities within their everyday life to incorporate more activity into their daily routines. We need to ensure that that conversation about physical activity is included in every patient contact, and that the supportive policies are in place to allow all of these actions to be implemented. And that's really important because not improving physical activity levels is costing the public health system an enormous amount of money and placing a huge burden of preventable NCDs, not just on the health system, but on the population in general. It's obvious that primary healthcare has a key role to play, and it provides an opportunity to support physical activity, but making sure that that counselling is delivered within the primary healthcare system needs to be supported by a system that backs that up. So with that, I would like to thank you for giving me the opportunity to share some of this work with you. I'll just point to our website where you can find all of these resources, and in particular the country cards if you're interested in seeing the data from your country from the Global Status Report. And with that, just thank you very much.
Muito obrigado, doutora Juana.
Thank you very much, Dr. Juana, for your words. I think that it was quite important for the intro, for all the work that will be rolled out after you, which is to hear the experiences of a number of countries and how they are promoting physical activity in their countries. On behalf of the General Coordination of Physical Activity of the Ministry of Health in Brazil, we would really like to thank you for your presence here, shining brightly in this conference on public health, and also to help you, thank you for your contributions for the physical activity and health. Thank you very much. Now, after this beautiful presentation by Dr. Juana, we will now go to the second session of our event, which is the session on international experiences. I'd like to remind you, speaker, the certificates can be obtained in our portal where you're watching our event, you will be able to get the certificate right there after the event. This event has also been broadcasted in our YouTube channels, data sources of the Ministry of Health, and also in the Pan American Health Organization, DV. The first international conference to promote physical health and public health counted with more than 2,500 people registered. We are quite happy with the number of people registered all over the world. More than 20 countries registered in this event. Let us begin then the session, which is a dynamic session. The countries have around 25 minutes maximum to present their actions, strategies, policies, and documents to promote physical activity. In this procedure, we are having presentation in the session of the first day, Brazil, Portugal, Uruguay, Argentina, and Peru. I ask you, speaker, with your questions, write in the chat. You have Professor Jean, Professor Sophie already getting the questions. In the end of this session, we'll be opening to some questions, some discussions regarding these experiences of your countries. Let us begin then. With that, I'd like to invite Fabiana Vieira Santos Azevedo Cavalcanti, representing the Ministry of Health of Brazil. She is General Coordinator to promote physical activity, the Ministry of Health. Fabiana, welcome to our first international conference to promote physical activity in public health. And I'll pass the floor over for you to say what Brazil is doing to promote physical activity. You're welcome. Thank you, Danielle. Good morning. On behalf of the General Coordination to promote physical activity, we thank you for to be here with us tomorrow as well. Ben, I think your mic is off. You're not hearing me? Can you hear me?
Estamos a ouvir.
Estamos a ouvir.
Oh, we can hear you.
Eles estão ouvindo, Daniel, na plataforma.
Tá, então pode continuar.
Eu vou compartilhar minha tela, então.
I'll be sharing my screen then. Let me just.
Vocês estão ouvindo tranquilo, né?
You hear me okay?
Então, continuando em nome da coordenação.
On behalf of the General Coordination to promote physical health, I'd like to thank you for your participation of all of you here in our conference, which was thought of with much care for us to understand a little bit of the world context to promote physical activity, especially on health and primary care to health, which is where we'll be speaking now. We have our focus in the Ministry of Health of Brazil to promote physical activity in the level of attention, primary care, in our case, in our Health Unified System. So we know, as we already said here by Dr. Juana, that was said here in a number of different other events.
Latin America has a high prevalence of inactivity, and therefore we have a lower prevalence of activity, physical activity. And according to Fischertel, which is a telephone research that we have, a survey that we have in Brazil every year, in Brazil we have the prevalence of physical activity of only 36.8% of the population that is coming into this recommendation of at least 50 minutes of physical activity every week. That is the goal for the Brazilian population, at least. So with that, we can see that we have a really low prevalence of physical activity, and we also have some goals, some targets to increase that prevalence of physical activity, especially in the during free time, leisure time in Brazil. We have incorporated that target in the plan for fighting non-communicable diseases and chronic diseases. The objective was to increase up to 10% of physical activity in leisure time, but for 2030, our goal would be a little bit more daring with a target for up to 30%. So based on those targets and in these low prevalence of physical activities, we have the increase. And in Brazil, we have been developing many strategies that uh, you will be able to check that it is according to the WHO recommendations in order to increase our prevalence of physical activity. And as we heard from Ioana, we have also a high cost of secondary care and tertiary care in the levels of more complex care in public health related to the low prevalence of physical activity. So we have some studies that show that the increase of physical activity in 10% in the population, as we have done in 2011 up to 2022 in Brazil, might reduce the costs of inpatients procedures. So these investments in physical activity, especially for primary healthcare, would cause, in addition to the prevention to non-transmissible chronic diseases and the promotion of health, it will also add to the economy of the levels of more complex healthcare. So just to remind you that in Brazil, our context of physical activity would involve 104 domains that would go through leisure time, commute, domestic tasks, and also labor time. So it is important to remember that physical activity is an intersectorial activity, like other health promotion activities. So we are going to have, especially in Brazil, a network for support of physical activity, which is quite comprehensive. It is also related to the sectors such as education, sport, and leisure, universities here, the third sector, as we also call the AS system. And in our place, we will speak more about the primary healthcare, which is more focused on the uh, health academy program, just like Juliana mentioned already a little bit, and also in the other facilities which are for primary healthcare, such as the basic health units. And coming into a little bit of our context of physical activities in primary healthcare, we have as guiding lines for physical activity promotion, we have the national policy for physical activity promotion. It has one of the strategies to promote health. That is one of the strategies to promote health. And we also have the plan for primary health care that brings into primary health care the responsibility of promoting health and also promoting the physical activity and supplying physical activity to the population. And within the general coordination for promotion of physical activity, we will have under the national policies for physical activity, we will have the guide for the physical activity of the Brazilian population and other supporting documents that we are going to mention in a few seconds. And one of our main programs and actions for supplying physical activity, which is Academia na Saúde, and also the program for physical activity in the primary healthcare, and other strategies such as the school physical activity program and Proteja and Conecta SUS Brasil and others that we are going to mention. So coming into more specifically the guide for the physical activities, this has been the document that brought in the first recommendations for physical activity for the Brazilian population. That was released in June 2021, and that was produced by Brazilians with the support of the of PAHO and WHO, considering all of the context and the supply of physical activity, the actual reality of the Brazilian population. The guide has been divided in 8 chapters. You can see some of them here. Chapter 1 will bring in some basic concepts about physical activity and physical exercise. intensity and physical exercise, and the other chapters will be divided by cycles of life or specific conditions. So the idea of this guide is to be a direct document turned into the population with a simple language, so that each life cycle or specific condition will be accessing specifically their own chapter. So the idea is that and each individual would read 5 to 6 pages of the guide. This is a very short document. It has about 60 pages, but the idea is to have each cycle of life to its own chapter, and each individual would access their own specific chapter so that they might have a direction very specifically in regards to the recommendations of physical activity in terms of intensity and quantity, and the support network and the benefits for health of the practice of physical activity, and the other issues also that are um, carried out in terms of the benefits and the offers of the supply of physical activity in the public sector. Well, as I said, chapter 1 will bring some basic concepts about physical activity. One of them would be the difference between the physical activity and physical exercise. Physical activity would be the behavior that involves voluntary movement of the body, taking the body out of the standing of the resting stance. So this would be and it would be dealing with the commuting and health related to work and other activities. And physical exercise would be more repetitive and structured and planned, usually looking for an improvement of physical capacities and weight. So physical activity is a more broad context, a more comprehensive approach that would also include the exercise, but not all physical activity is considered to be physical exercise. So we also have a larger locus for physical activities within those 4 domains, and we also have physical exercise, and we have sports, and also bodily practices and dances and integrative practices as well. The guide will bring some key concepts over the chapters, and here we have a highlight of 4 main key concepts, which include the concept of early initiation in physical activity in the life of individuals, so that it will be turned into a habit more easily, and bringing more benefits to health. And just like Juliana mentioned, each minute of physical activity will count. So even if we don't have the target, if we don't meet the target, the more physical activity we execute, more benefits to health we will have as a population. And in general, mind you, the recommendation for people who are older than 18 minutes is at least 50 minutes a week. We have also a central discussion related to this issue of physical activity. This is an action of promotion of health. Not only that, but it is also a sectorial action. And just like the majority of actions for promotion of health, it doesn't depend only on the personal decision. It also involves many factors: environmental factors, public safety, collective factors, and commuting and air quality, the supply of opportunities to have physical activity and to undertake them. All of those factors will influence the level of physical activity of the population, as well as influencing the other actions for promotion of health. In this guide, we also bring in a few examples of sedentary behavior, always saying that, for instance, we have this recommendation of breaking in this behavior at least once an hour. So you might be, going upstairs or getting up to drink some water or to eat a fruit during a short period of movement, going to the bathroom. But we do recommend in this guideline to do that at least once an hour. As we said before, we have these 5 versions. We have the first document. This is the first document in the history of the Ministry of Health that is in Braille. We have this Portuguese version as well, has been distributed throughout Brazil in the first edition using 75,000 copies, and we are distributing that also for public institutions and private institutions who are going to also receive those in Braille for people with disabilities. So if you know this audience, you can talk to the Ministry of Health so that we can send that using the ministry itself with no cost for the receiver. As we mentioned, this guide has been created very simply. It is very a short material, so it is very easy to read, but it also seeks to increase the access of information, both by the health professionals and the other sectors that might be involved with this kind of work with physical activity and the population in general. So we have shortened this guide and then we have released those charts. So these are very short materials. It's like half a page, which will bring some summaries of recommendations for the population in general. So this is available online using this QR code or using the PS website, which can also be printed by all users, and it is also available in our event website in the International Conference for Physical Activity. So for this implementation of support of disclosing this guide, we have many materials available. They are also available in the website for the APS, the primary health care of the Ministry of Health in Brazil. They are supporting many sectors to implement those guidelines. So here we have the recommendations for healthcare professionals to implement the guide, the recommendations of practices for primary healthcare, and also 3 documents that are related to some of the more specific sectors for implementation of this guide. So one of them is related to the intersectorial activity in physical activity. So this is a document that goes through the ministries of the federal level. So, but they can also be replicated to the local levels in the other sectors. We have a second one, which is for higher education institutions, and a third one that is intersectorial, that is going to the State Secretariat of Health, which might also be replicated by the municipal health secretariats. We have those 5 documents that is supporting the recommendations for physical activities. And coming into those 2 programs and initiatives that we have for the implementation of supplying physical activity in the public health system, and more specifically in primary healthcare, we are going to start speaking about the Academia da Saúde Health Academy program. It is a program that has been one of the main initiatives in the Brazilian Ministry of Health. It might be used with those 8 categories more related to the physical activity. Despite having those 8 categories work in this program, more than 85% of those actions in the program will be physical activity actions. And within those 13 professionals that might take action in physical activity, according to the Ministry of Health, 90% of those professionals will be physical activity, physical education professionals. And currently, throughout the Brazilian territory and the 5 regions, we have more than 3,000 hubs which has been built already for this program. And those hubs include 3 kinds of facilities for health, which have been built to offer those 8 actions for health promotion. Among those, we'll have physical activities. That will be the basic, intermediary, or advanced hubs. And they have an area, and they also have a financial amount that will be sponsored by parliamentary amendments. So the congressman will set resources that go from 124,000 up to 338,000 BRL, depending on the hub and the size of it and the region of the country. And the congressman will indicate where they want to send that resource, and the Ministry of Health will decentralize that budget and make it feasible to build those hubs in one of our more than 5,000 municipalities in Brazil. Currently, in addition to that direction by the congressman to build those hubs for the Academia da Saúde program, the Department of Health is financing every month more than almost 2,000 hubs for physical activity promotion, so that we have 51 million BRL to finance all of those 1,700 hubs with 3,000 BRL every month to finance those activities. So quickly, we are going to see a bit of the evolution of the amount of budget that has been spent with the costly maintenance of the Academia da Saúde program. So we started with about 2.5 million BRL, and 2022 we got into the level of 51 million BRL. So we have had this progressive increase of budget, and on the right-hand side, we can see the amount of actions that we have developed in these hubs for the Academia da Saúde program that involve 18 categories of actions. And then we also can see the amount of participants that is represented in green that are actively taking part of those actions in the hubs. So as we can see, we have had a peak in actions in 2019. And with the COVID-19 pandemic, we have had a decrease, a steep decrease in 2020. And starting in 2021, we have been working with the coming back, resuming those actions of the hub for Academia da Saúde program. And reminding you that within the public health system, those actions for health promotion, among those, the physical activity actions have been drastically damaged by the pandemic, especially because they are collective actions. So due to the social distancing guidelines, we have had this huge impact. And starting in 2021, by the end of the year of 2021, but especially 2022, we have had this resume of these actions developed in these hubs for the Academia da Saúde program, and consequently in an increase in the number of participants. Another initiative that we have for promoting health, which has been launched in 2022 in May, was the incentive of physical activity in primary healthcare. So as we said, the Academia da Saúde program fosters the development of 18 categories of action, and physical activity is the main one. And here we have the direction of a little bit more detailed directions for the actions of bodily practices and physical activities per se. So as we have highlighted, also the Academia da Saúde program is built with the resources that come from our congressman, directed to build these hubs, which will serve the primary health care. But in terms of incentivizing physical activities, we have the use of some establishments, some facilities that have been already built and are already in use. So some of them will be the basic health units, the riverine basic health units. So one of them will be set towards the build of this facility, which will be the hub for the Academia da Saúde program, in order to develop 8 actions for health promotion. Among those will be the physical activity, which is the most important one. And here, with the incentive to physical activity, we take advantage of those spaces in primary healthcare, which already exist, in order to carry out physical activities as well. The incentive for physical activity has been built with 4 objectives: to increase the hiring of professionals for physical education in health, primary health care, to promote and foster the acquisition of consumption materials related to the physical activities, to qualify and train the environments for physical activities using reforms and maintenance, and to finish to improve the care with people with non-communicable chronic diseases.
The attention to this kind of activity happened through a request of accrediting through the Brazilian municipalities. All of the municipalities could request this participation in this kind of physical activity. This request happened in May and June this year, and the 5,670 accredited 4,128 municipalities with 8,230 municipalities in those health units for the APS, in this basic units, this base primary health units. For 2022, we have a total budget of nearly 100 million reais. Effectively, we paid off, like Jenna said, 50 million reais to this 4,128 municipalities. This payment for municipalities varies according to the kind of activity, unit, health unit, or the presence or not of a professional on physical health. So according to establishment or the absence of a professional in physical education, or one for 20 hours terms or 40 hours terms, the resources allocated varies from 500 to 2,000 reais. So we have a difference in regards to the program Academia da Saúde, passing on 3,000 reais related to some monitoring criteria and the presence of one of the 13 professional profiles that can operate in the unit. And in the sense of physical activity, have a number of ranging from 500 to 2,000 reais according to the kind of unit accredited to this physical activity, the presence or not of a qualified PE teacher according to his workload. So now to support implementation of the Academia da Saúde program, incentive on public activity in primary care, we have these material, we have a manual handbook, Academia da Saúde, that was reviewed, relaunched in 2020, Academia da Saúde program in 2011. Here we have two other extra materials supporting the implementation of primary care activities, with all this material made available also in our website of primary care in Brazil. On top of that, we are at this moment, we're following one of the guidelines of the WHO in a public call for physical activity in primary care for the health unified system. These are all for the health professionals, the primary care, that is for the PE professionals and for other professionals as well, for them to do the counseling using all the contact that the user of the health unified system has with the primary care, with the health unified system, to accomplish counseling and physical activity, to spread this information on the guide of physical education for the Brazilian population, spread information where he can provide his activities with the pole of Academy of Health and in primary care and health. This consultation is open to November 30th. You can check it out through the QR code. We request participation of all stakeholders, everyone related to the health unified system, especially in primary care, to check out this previous council. And our department is ensured that the general promotion of physical activity already has other versions of this in different terms, like for example in food and nutrition, and we are also working with this on physical activity as well. So when we speak about a brief consultation, this is an initiative to all professionals, health professionals. This is not an initiative specifically to a specific unit, a core. We're speaking on general terms in our case, based upon the Brazilian population handbook, following the instructions by the guidelines by the WHO. Dr. Juana shared with us. We also have other offerings as well of counseling and physical activity to promote physical health, to promote healthy ways of life in the health unified system, among which one resource which is called Peso Saudável, healthy weight. We have, it's an app in Brazil developed by the Connect SUS. This app was very widespread in the Brazilian population from 2021, because through this app, the Brazilian population can get a certificate of vaccination of COVID-19. So today, basically, whole population downloaded this app on their phone. And in this app, the Brazilian population can have access one of the functionalities called Peso Saudável. In this resource, there's a 12-week program which will be bringing two axes, one on healthy food and other on physical activity, toward instructing and giving challenges and recommend for a healthy loss in terms of improving quality of food, food intake, and a more active lifestyle to increase the levels of your physical activity. This functionality was developed by the professionals working in the Ministry of Health together with some experts in food and physical activity based upon the guidelines of physical activity for the Brazilian population in the case of the mode of physical activity, and the food handbook for the Brazilian population in the case of the proper and healthy food intake. We would like to invite everyone to check out this resource, this app, to share the word on it. And for those who are not from Brazil, they can also download the app, connect to us, and get to know a little more on our experience for this experience to be also replicated in different countries. Department to Promote Health of the Health Ministry in Brazil also counts on a communication channel, direct communication channel with the population called Plataforma Saúde Brasil. If you're to check out, type in Google or any other search engine, you can throw in Plataforma Saúde Brasil, then you'll see directly a link of this direct communication channel. It's a hotline with the population working on some access to promote health, among which to promote physical health, health intake, fighting smoking, and to prevent COVID-19. In this platform, there are contents related to the population, both written and also in podcast and video and pictures for the population to check out these information. And this platform is very well accepted by the population. Even the Instagram of the Ministry of Health, and very well shared. The more access and sharings and views than the Instagram, the Ministry of Health. It is a platform developed by the Department of Ministry of Health, where we see many contents on physical activity as well. Another strategy of the Ministry of Health, counting on acts to promote physical activity, is the Programa Saúde na Escola, which is one of the oldest programs we have in the world, integrating health and education to bring actions to promote health and to prevent diseases. This Brazilian students will have 13 subjects to be developed together with the Brazilian students in fairs to promote physical activities. In these 3 subjects, promote physical health is ranked 5th as the most covered subject with students, and quite recently in 2022 was launched a technical handbook and a pocketbook bringing practical activities to promote physical activity toward the Saúde na Escola program. So these documents that will cover physical activity in the school health is also available in the primary health system. Let me share the link here with you. We'd like to invite you to get in to see these new material on physical activity to this program. Also, we have other materials related to these 3 subjects. We also have in the Department to Promote Health, also coordinated directly by the General Coordination of Nutrition, Proteja, which is strategy to prevent obesity, child obesity, leaning toward municipality to be healthier. Municipality, Proteja gives us actions, mandatory and optional on food intake and nutrition, and also physical activity for the municipality to become healthier setting to be protective for child obesity, which is a serious problem we have in the world and also in Brazil. Proteja will have a number of different actions to children as well, who are already in child obesity. So in Brazil, we have 1,320 municipalities participating in Proteja, joining this program with investment of Brazil, more than 32 million reais per year, Brazilian reais per year. And we have different actions related to physical activity. Some are mandatory and some are free electives to make municipality an environment to practice and foster physical activity. So to wrap up, my time is up. So here we are bringing you the main strategies that the General Coordination of Health has for 2023 to promote physical activity in the health unified system, SUS in Brazil, and also in the primary care. Always with a directive to implement and to widespread the guide of physical activity to the Brazilian population. We have this challenge of broadening the program. Academia da Saúde, we spent many years not being able to broaden or increase, expand the number of units of course. 2022, we're able to increase the cost more than 250 poles of those units, reaching 760,000 poles on a monthly basis according to the monthly criteria. We have a challenge of to implement fostering physical activity in primary care and health. We are in the first semester in adaptation phases of the municipalities, so that from 2023 we reach the goals regarding to implement physical activity in primary care and health. We have a challenge of launching and implementing the brief counseling guide, which is in a public consultation status by November 30th. And we also have a process to launch and implement a survey, which will measure the level of physical activities through the main system, primary healthcare, which is called ESUS. This survey will be measuring the level of physical activity of users of the health unified system, is in a validation process on site in primary care. At this moment, 2023 will be launching and implementing it. I have this challenge also in 2023 to launch course on e-learning course on the incorporation of agendas to promote physical activity in planning and management of the health unified system. So it's a more administrative matter, but it's also related to management, how to insert promoting physical activity in the planning processes, the different planning process that we're having in the health unified system, state and federal and municipality. And also we have a partnership that we can have technical support to all the 500, for all the municipalities in Brazil, more than 5,000 municipalities to promote physical activity. So Brazil is a continental country with regions that are quite different from each other, with different municipalities and distinct from each other. So in 2023, we have this challenge as well to train and have a capacity building to promote all municipalities that we spoke about in our presentation. So with that, we would like to reinforce your participation, and we thank you for being in these 2 days with us. We hope that this is quite enjoying for you, and we leave our contact information for us to closer contact with the international community and the national community, the Brazilian community, whether in management, users, null, and for us to advance and progress in making it effective, the physical activity in health unified system, especially in primary care on health. Thank you. Thank you very much, Fabiana, for your explanation representing the actions and covering a little bit of the actions conducted by the Ministry of Health in Brazil. And let me invite now, this moment, Marlene Nunes Silva, Director of the National Program to Promote Physical Activity, the General Direction of Portugal. Thank you for being here, Marlene. And now to pass the floor over to you. Good afternoon, everybody. I'd like to thank before anything, also institutional and personal way, the invitation to join and I greet all of the participants here, especially the organization for this event. And I share this good practices. So from the Portuguese part of the national program to promote physical activity on the general direction and health, we are seeking in a very playful way to show you what we're doing here, namely in the National Health Service, especially on primary care, and briefly other actions and different access that we are having as well, which is not the focus of our communication and the conference today. Briefly, just to show you that the organization of our services is different from country to country. Our national program to promote physical activity, it's a priority service that the health service has and functions under the general direction on health. We have 4 strategic axes of the action, education, civilization, environments and context of life, good practices, surveillance, and one on systems, health systems that will be centering our communication today. Each one of those follow the international guidelines, namely in the different axes of the plan of global action for physical health, and also recommendations of the cost-effective actions of the agencies to this level. In fact, covering a little bit of the actions we have in this acts of physical health to generalize brief counseling and to train professionals according to this GAPA. We uh, not to spend much time, but also to manage better our time and evidence on the importance of physical activity, so on and so forth. I'm not bringing also the importance of physical activities in primary care, all the events here that we see here to share this good practice, but evidence could not be greater, systematized. Many documents, if I have to highlight some, I would highlight this, toolkit by the WHO to this, the so-called attention to the importance system of patient assessment and counseling and brief counseling in the primary healthcare. What is a brief intervention is also written. We also have documents, reference documents. We don't need to invent the wheel. We just have to really implement it. It's not so easy. May sound. Here we'll be sharing more difficulties and challenges. So I really am enjoying hearing the experience of the different countries and the function they're seeing, because many of them can help us as well. But a brief intervention must then has a combination of measurement and the brief advice. From 2017, Portugal is issuing a model to promote physical activity in the health unified system. Before that, we did not have it. So this ministry decree, we had the goal of integrating, promoting physical activity in healthcare, and also to improve capacity building of professionals, to articulate the action of SNS with resources to promote physical activity in the community. How do we do that? So here we have a roadmap. We'll be covering step by step all the ongoing actions, which begins actually with systematic assessing of physical activity and sedentary behaviors. We in fact have some supporting platforms, digital platforms, to support our consultation on primary care. In our country, we call them Ask Clinic, where doctors during their services in the primary service, they record the data on these appointments, BP, so on and so forth. Ask Clinic serves for that record. We have some medical electronic reporting. We also then we issue out a medical description or any kind of a prescription to use of medication and so on and so forth. So then we capitalize through these digital platforms to develop tools with the goal of promoting physical activity.
And therefore, we count with since 2017 with this module for the evolution of physical activity. So you can see my mouse pointer here. This is what you will see in the menu. And here we have a tab only for physical activity and the assessment of physical activity. So this has been standardized during all of the meetings, so with the standard time, so we have an opportunity that we cherish here in all senses. Here we can assess the frequency, the weekly frequency, the duration, and the sedentary behavior time. So this is a vital sign of health using the protocol for assessment that has been standardized in this methodology. We have increased that since 2017. This use has been increased greatly in this assessment for healthcare assistants. And after the pandemic, we have had a stabilizing number here because we have suspended most of the non-priority consultations. And we could check that those have been kept regularly, and now we are going to have a new increase to be computed in order to come back to the levels before the pandemic. So we have had this monitoring going on, and we had a very good methodological assessment of the behavior of physical activity. So we have national surveys every 3 years. During the pandemic, we have had that as well in order to check the levels of physical activity in the population. But the protocol is done during the appointments and done by the person when they are being assessed by the doctor. And we could verify that 33% of those have been reaching the recommendation of at least 15 minutes of physical activity a week. So it is interesting that those figures are very similar to the national surveys of other systems. This is usually varying a little bit by age group, and men will do more some places, or women will do more in other places. But we have had a continuous assessment of those figures, and the people who have been assessed more than once tended to increase their levels of physical activity. And this monitoring, this longitudinal monitoring is very important. And in fact, many times these monitoring, even if you have no time for anything else, or if you have no resources added to it, this assessment will be paramount to the understanding of how it goes. So you just ask, you knock and the door will open, right? And sometimes you just ask that to the patient, and then the patient will give their answer, and people will have the will of possibly understand, well, why can I do more, and can I have more physical activity so that during my next appointment, my doctor will ask again, and then I will probably have the will to do more. And that will be the beginning of this behavior change, especially for patients. So the assessment, in addition to the assessment, we also have the system for brief counseling with in-person counseling and digital tools being used in general for that. And here I have to introduce just a concept in parentheses, because sometimes people will make a confusion between prescription exercise and brief counseling. Sometimes the prescription can be done by people who have the credentials to do so, and counseling can be done by anybody to anybody. So it can be done in opportunities during all appointments, and we have this consultation model for the description. And now we are going to speak about the brief counseling in general in primary healthcare. And you can understand as counseling all and any recommendation of physical practice, be it verbal, digital, and these can consider the preferences of each individual and their context in terms of their autonomy. And in 2017, we launched the tool, and we asked the population whether or not the doctor would, in fact, if they had an appointment, if the doctor would incite the physical activity practice. And most of our population said no. We also have those monitorings going on with the healthcare professionals. We also monitor the practice in terms of physical activity promotion in the health system. So it is interesting that almost 85% of the professionals would say, yes, we do endorse that. We frequently ask patients to take action and do some physical activity, and people are not lying. You know, people would say the doctors don't, and the doctors say they do. And sometimes people just don't consider that they are speaking about physical activity or doing it as best as possible. We would waste time if we would think that they are lying. So we have to think about the best guidelines to have brief counseling, and this has been well established in the literature. So this is to be used in order to give support to this program. So in Portugal, when we usually hear, for instance, the tools for brief counseling, we had gone to the literature to understand what would be the optimizing factors for the brief counseling. And in summary, we have it has to do not only with physical activity, but also with the barriers and preferences and the readily availability of those, and the multiple strategies for behavior change and tools for that. So action plans, objectives, and so forth and so on, that would also develop self-action, and the need to train more professionals and leave them with support tools that make their lives easier, so that the time for consultation might be reduced, and we don't want to create one more problem for people to solve to something that is already something that is very full of information. So we have to facilitate those counselings, and that is the principle that has been guiding our action. And as a consequence of those assessments that I shown, this is an algorithm that we created with the system based on the level of physical activity, if they reach that level or not, and it will give the professional some possibilities of guidelines in order to discuss with the patient. So these guides, these instruments and tools intend to facilitate the counseling, and they're based in scientific evidence, and they have been developed in order to be self-explanatory. So those are files. So if the doctor has time or the nurse has time, they can discuss that with the client, or they can just send that to them and talk about it next time, because everything is self-explanatory and it can be explored by the users themselves. So this can be sent via email or telephone and so forth and so on. And these tools, in addition to being in the system for support of the National Health Service, as we know, we have private services as well. So we can also have that in public download form. So any doctor, any person can, you don't need to be a doctor, any healthcare professional can download that from our website. That is www.pnpaf.pt. And then you have the resources there available. And these will be the guideline in more than one layout, depending on the interest of the person. You have many guides depending on the profile of the user. So this has been some key recommendations. What are the strategies that we use? And above anything else, the kinds of advantages and benefits from physical activities, inviting people to mark with an X those that they like the most, because people have to assess themselves. We don't have to tell them what to do, because otherwise they won't feel that that is relevant for themselves in changing their behavior. So some people might be in doubt, you know, they might have questions about it. So you have to work with readiness and motivation. That is readiness, as we call it. And we have also guides to work with pros and cons of change and to increase the chances of people taking part in physical activities, and what kind of evolution you might have and how can it help you. Those are the things that I find to be important in my life, my facilitators, and so on. And for the users, we have to consider to when they want to start with physical activity, we also have an action plan for defining goals and strategies for implementation, when, where, and with whom. And if I cannot do one thing, what can I do to replace it? And we also have a high incentive for self-monitoring, which includes some tools we have for mobile, and the person can monitor themselves. And we also have some guides to keep those active users engaged so that they can become leaders and inspire others. So synthesizing it, we have different guidelines with different profiles of users, and also we have some plans that might help the professional to realize whether or not they have something that they can do with 1 minute, 5 minutes, more than 5 minutes of appointment. How can I help this person? How far can I go with this patient? So it intends to be very realistic in terms of the intentions of those appointments. And then we have the ongoing pilot project. And in this case, we have a consultation of the description of physical activity. So those tools, the digital tools, will be for counseling and assessment. So they are generalized, they exist in the system to be used. And this is a pilot project that has been developed in some healthcare units in our country. Where I'm going to mention those. The numbers in Portugal are more very tiny. We are a very tiny country, so when we speak about such a unit, we have expressive numbers here, but they are relatively low for other countries. And here we have the prescription in terms of how many prescriptions we have per appointment. So this contemplates the time and the aptitude for physical activity and the amount and kind of exercise people can take over, can carry out. So we have the whole protocol that is much more incisive. Brief counseling is here. So we have the green light. In the yellow light, we have physical activity and in chronic non-communicable diseases. And we also have here for anxiety, depression, and diabetes. So type 2 diabetes, according to Prevailers, and also for as a consequence in the pilot project, we have the discussion going. But the idea was to disseminate those for all of the chronic diseases. And therefore, we have the difference here where we have this appointment that is going to take place, be it by with a doctor that has a postgrad in sports medicine or any kind of healthcare professional. So they have different competences here. It goes according to the clinical history of the patient and these the possible interactions and so forth and so on. And the healthcare professional will also the physical activity professional will help with the anthropometrics assessments and the description of the plan and the follow-up. And whenever possible, they will also forward those patients for community resources because they can also have an exercise plan with a senior sports program or diabetes program and so forth. And that is always a preferred way. This pilot project has been launched in 2019, so this has been launched nationally. We had more than 90 professionals from all of the hubs that have been created. So whenever they manifested any interest in being part of this pilot project, and we have produced many manuals for supporting that training. So we had 13 units in 2019, and they started with the start has taken place in January to May because we had to start the program slowly. So they were according to their own capacity. However, during March we started lockdown just like any other country. And so the months have varied a little bit from country to country, but we had almost 2 years of severe restrictions and suspension of non-urgent consultations and appointments. So only now are we in 2022 in March have we resumed those activities in some units. Some of the units wouldn't have the capacity to implement that because they have had some restrictions. Other new units have been interested in taking part of those pilot project. And we have the new units starting as well. So we have to still develop that in the country. And depending on each region, we have to assess them according to their capacity in taking part of this pilot project. So they have this installed capacity. So if you have a doctor there who is developing this appointment, maybe they have a mother license and they have 3 months of leave. So this might happen. So here we have a short video so that we can at least have an idea of how this happens, you know, these tools in the system. I hope you can hear that. Did you know that more than 2/3 of the population in Portugal said that they rarely take part in physical activity due to lack of time or motivation? And it is not only about sports or physical exercise, but also to simple actions like walking, going upstairs, and spending less time sitting down. The General Health Directorate wants to change that. We have had created the National Health Service in 17 to follow up the physical activity of the users, just like the arterial pressure, weight, and history, family history in diseases, and the level of physical activity is assessed and registered. It's a normal consultation, a normal appointment. Then we can investigate the basis of the clinical situation with 3 questions. Just asking the question makes the person ask themselves if they can assess their own benefits, if they can manage to have some. After the assessment, we have a brief counseling going. The user receives that with some counseling about the physical activity practices, always to their particular case. So this documentation is self-explanatory and based in scientific evidences to help the user to make their own decisions, to plan and monitor their own physical activity. Many users will have a growing thought that something has to change, but that's not all. We also have the implementation of a pilot project that goes and with this change farther away. So this is going to change. Oh, I'm sorry. I apologize. I clicked the video. Let me see where we stopped.
Para já a ser realizado junto de utentes com depressão e diabetes tipo 2.
This is going to be carried out for users with depression and type 2 diabetes. In practice, this is a pioneer physical activity and a follow-up with specialized professionals such as doctors with sports medicine specialization and a physical activity professional. We know that we not only we can manage to prevent diseases, but we can also, if we have the disease, we can retard the progression of it so that we know scientifically that the physical activity brings those benefits. And that's why nowadays the physical activity is one of the vital signs for health and well-being. So in those appointments with physical activity, what I do is a diagnosis for the state of physical conditions of this person. And then I have a prescription that is customized so that for that person in that moment. So the person will be either led to a community project because we have protocols so that they can find other people and socialize. And here we have different characteristics that we have to work with, or they will have an individual plan. So we have to realize how they find themselves right now, and then we have to work from that to bring them more quality of life. More than 3,000 users. That is it. I think that then we will have some testimonials, and I won't waste your time with that. But this consultation, this appointment is more than the efficacy of that. Is already good. That is known in the literature, and that's why we have to study these conditions for implementation. It is very hard to scale those interventions, and there are many barriers linked to the healthcare. And that is the experience that I think is important to share. And we had a weekly monitoring of all of these hubs being monitored, and we deal with the barriers and the facilitators. And in fact, we have developed this strategy toolkit in order to attend to those units using these numbers of activities. And in addition to that reference, we can also use directly the appointment in order to make the visibility higher in those hubs where they exist, among other solutions. We also have bet a lot in the training of healthcare professional and exercises. So we have many books. They are free for download in our website, and we have those in the resources page. We can also have a deeper manual and other tools in many layouts, and we also have developed a platform for training the trainers in partnership with psychologists, with e-learning, and all of the psychologists that can work with healthcare, primary healthcare, so that they can deal with the brief counseling, and then they can train people for brief counseling to other healthcare professionals in those respective units. And we managed to cover more than 90% of the psychologists that can that take action in the national territory, and that is very important for leveraging this training of trainers that is very scalable. And we also have ready this training, the national training, using the digital platform for national training that is now. The platform is called Now, and this is ready and loaded, and it is going to be launched in January. And we also are part of the European physical activity prescription community with the EUPAP program from Sweden, and we are going to scale those policies, public policies for promotion of physical activity in primary health care as well. This has been shown to be a good practice in order to leverage the training of focal points for the training of healthcare professional. That happens as well. EUPAP is already almost in the end.
We also are promoting those practices in the physical activity. We have many surveys. We realize that therefore these professionals who are promoting physical activity, the main of those have to do with them working with primary healthcare, with expert doctors in family medicine and general medicine, having higher levels of physical activity, therefore promoting physical activity of the health professionals. It is essential exactly for active patients also to have training in the field. This is quite important. Very quickly, I will go over the activities of other access, just for to have an idea what we do to different levels. Surveillance and monitoring, it is something that it is very dear to us and we're investing very much. We look to epidemiological surveillance not only on prevalence of physical activity and sedentary behaviors we had in 2017, 20, 2021, and we're scheduled to go back to 2023. And also we are monitoring the policies on to promote physical activity with the determinants, psychosocial and environmental determinants, professional practices as well, which are being monitored by us. We're developing activities to support epidemiological survey, systematic review on the best tools. This is a book to be downloaded in our website also. It's also open access. You can get more information there on this theme. During COVID, the time of social isolation in April 2021 and May 2021, we had a national survey to physical activity. Also, we published that in this international survey magazine. And we saw in the level of physical activities decrease, of course, because people are locked down. So 1 year afterwards, after the second lockdown, I had an increase of the level of physical activities. The next metering will be essential to show us if this positive sign will just a reaction to people are in lockdown because the doors are open up, everything increased, and the practice of physical activity was also greatly. I don't know if that would be lasting on a day-to-day of people's day-to-day. Also, this standard in this survey of the physical activity with health behavior. So those who are practicing more physical activity have usually tend to eat better. This is quite interesting. So we to promote one behavior, the other, the both at the same time, functioning well. Of course, that gender, school, as also say, we'll see still the social inequalities, communication and awareness. We have a number of campaigns, of communication campaigns to promote readiness and physical literacy. We have Siga ou Assobio, a public campaign, a mass media campaign, in through them different characters. We wanted to show physical activity as a possible for everyone, for any level of skills, to any kind of possibility, for any kind of vehicles or walking, riding bikes, a motorbike. It's a multidisciplinary way of behavior. We have a problem in our country. More than half the population that I consider walking or going upstairs as a physical activity. Therefore, we wanted to change the scenario and to show that anything that can be a physical activity, how can be integrated in our day-to-day, how the physical activity is present and calling for us. It can be positive, motivating. this paradigm that will go from motivational science, physical activity to be something positive, not just that I have it and I must do, but it's something that I want to, something that adds up to my day to day. I don't have time to show my campaign. I don't want to extrapolate my time, but if you type in siga o assobio, follow the whistle, then you will see the video, Portuguese, English. You can work with that material. We play for you quickly a video clip in our PowerPoint. So follow the whistle. If you want to know about this campaign, there's a paper published in open access also. We had a correct evaluation of good practices and campaigns of public health. These two things are essential with this form of evaluation. Process evaluation and impact evaluation to show the three axes that were designed this campaign. Increase of competency, opportunity, sense of opportunity, motivation, and participants. We had a number of infograph material. We translate recommendations of the WHO through our metering. We got to half of the population, and 70% of them consider these material to be useful or very useful. We are present in social media and conferences and so on and so forth. And all our materials, like I said, this is essential, are available for free download in our website. Here on resources, you can see the different guides, infographs, reports and activities, yearly reports. So I'm almost done here, Danielle. In my last axis of good practice, community interventions. We have some fundamental actions. I don't want to, would like to go over that before I finish, to create the intersectoral committee to promote physical activity. CPAF in 2018, the best practice. This intersectoral coordinated work with science, technology, higher education, Ministry of Work. We coordinated all those. But this committee, essentially, Central Committee was working just for 1 year. The Minister Remodeling called this commission. They're still to be reactivated. They are still on hold. So we need all the advocacy possible for this to go back to work, because this intersectoral approach, according to literature, this is one of the most important things, but most difficult ones to get this report that was shown, the World Health Organization showing that very clearly that most countries do not get it. The most sectorial approaches, they are not interested in hearing other people's experience. Lastly, we developed a tool to assess good practices in community-based interventions, which is physical activity promotion. We see all entities who are the stakeholders with community interventions for them to assess the quality of their intervention based upon the good practices literature, and to see what they have, what they can still do better. So this is a self-management tool, but also for a free download in our website. It also helps those who are developing these interventions to assess them. All the community partners, we are doing everything or thing that we could do. If you want to be governmental entities to apply and to assess the existing interventions, we also have a format of tab to apply that in interviews. First, to have a national score of intervention. Once again, for free download, we have community interventions like Diabetes em Movimento, gain the best practice with the European Commission. We know this last week, so we are very happy with the promote physical exercise and diabetes type 2 patients, and also some healthcare professionals as well. So we have many challenges ahead of us. The best of all will be really in the primary healthcare, scaling up using the tools they are available. Any doctor can use them, but the doctors, they have a lot of requests. They don't have to increase through to have more investment and to adopt those tools also to not just for the adult population, also for scaling up of the project pilot to be a reality, the physical activity in all units. We want to reactivate sectorial commission, launch campaign, get good press all to the campaign. Need many activations, not just one. We'll continue with the surveillance, the North Korea surveillance. With that, I thank my team. This is many people's work. It's a multi-sectorial, intersectorial team. Very complex with a multidisciplinary approach. And the last in-person event that we held even before the pandemics with the different stakeholders of Ministry of Health, Education, and Sports. And I'd like to thank you all for your attention. We're all together to promote physical activity. It's a pleasure, and I'm here interested to hear all the other practices as well.
Muito obrigado,
Thank,
Marlene,
thank you, Marlene.
Acho que foi os conferencistas que estão nos ouvindo aqui, acho que
all the speakers hearing us here.
a gente começou, acho que com essa
I think
experiência
that we began with the very good
tem
experiences.
muito colaborar
A lot of people are cooperating and collaborating. We have
agradecer
much
novamente o
collaboration with
do convite para estar participando nessa primeira
thank you for
conferência
being in this first international conference here
atividade física na
to
saúde
promote
pública.
physical activity in public
Agora,
health.
o próximo país,
Let us
né,
go
mas
next up now to Uruguay.
isso eu estou convidando a Maria
Then I'd like to invite Maria Rodriguez, coordinator of the
transmissíveis,
non-communicable diseases coordinator, who's here with another SPR, to show us some practices in Uruguay. Maria, welcome to our first international conference to promote physical activity.
a palavra é de vocês.
And I'll pass the floor over to you.
Você tá muda.
Maria, you are on mute.
Buenos días a todos.
Ok, bom dia a todos. Muito obrigado, Maria, for your invitation.
Compartir la pantalla para ver nuestra presentación.
Now I'll be sharing my screen here to
¿La están
share my
viendo?
presentation. Sorry. Can you see my presentation?
Afiliada.
Is it shared? Yeah, everything's okay.
Pido
All right.
disculpas porque,
Sorry,
em,
first of all,
la presentación
because this presentation is in Spanish. I'm sorry about that. But anyways,
despacio y
let us go slowly.
bien.
And regarding physical health and physical activity and health, we see different aspects. We are working on Uruguay, intersectorials, guides and manuals, community environment, education environment, surveillance, and national surveillance goals 2030. Regards to intersectoriality, as mentioned before, Uruguay, we're working for the National Secretary, Sports Secretary, Secretaría Nacional de Deporte, with the Ministry of Social Development, MIDES, with the UNEP, Public Education Association, which is the entity related to all the public education. In regards to academia, we are working with the Cátedra de Medicina del Deporte y Ejercicio, and also with the Physical Education Institute. On the other, with the Honorary Commission for the Cardiovascular Health, and with department tendencies. We have departments in Uruguay, and each department has a department government. These are some stakeholders in this intent to work in an intersectorial way. While regarding guides and manuals, we have, on the one hand, physical activity guide for the Uruguayan population, which was drafted in 2017. Currently, we have just finished to update physical activity for the year 2022. Basically, the differences with the previous one is that on top of having definitions of what is physical activity, sports, and everything, as distinguished like Fabiana, also these recommendations for the data groups And besides that, we mentioned something that is it's been for a while taking more and more importance, the distinction between physical activity, what is sedentarisms, which are similar but different concepts. And lastly, we have more focus on the health professionals. We have a manual to prescribe exercises. We are designing that. The idea is this manual, it will be a manual for prescription of exercises. It's in the design stage, focusing above all in some pathologies, in non-communicable, in NCDs, non-communicable diseases. This is our physical activity guide. On top of incorporating these concepts, it also incorporates recommendations of activities for -5 years of age people, individuals, children. Also recommend physical activities, the matter of people who are handicapped. Basically, this would be the incorporations regarding the physical activity guide. The one currently now will be replaced by a new one. Regarding to community environments, we had use a guides to use in open air settings in gymnasiums, incorporated in open air environments. So they made a manual to be using this matter to use in open air environments. We also have videos for adults, physical activity video clip for younger adults or even elder adults. This material is in the Ministry of Public Health. And I'm sorry that I did not introduce you, the director. I just finished my presentation. He just came over, so I will introduce him in a few minutes. But then lastly, these videos on physical activities for older adults in our countries, then many of the people who are already retired, we give them this kind of tablets to teach them how to hold their physical activity. So we want to highlight these public places for people to conduct their physical activities. Another guy, we have what we call it sports square. That is in different places, different departments as we call there. We also have Montevideo specifically, which is the capital. Besides those squares, we have the idea of having the same gyms in a public space, some public spaces. And this way, when people go and look for their doctors, the doctors make some kind of recommendation, indicate that they have to hold some physical activity, can even indicate some of those public spaces. People can have this kind of physical activity. And in a freeway, many times these doctors can also refer people to do some sort of walk to avoid some kind of vascular accident. This is very good for this patients and important to avoid diseases. As for environmental educational systems, we had the law sanctioned that the law sanctioned that is makes mandatory the law of 18 to 130 that declares mandatory to teach physical education in primary schools. In 2013, the law 1940 was passed with the goal of promoting healthy diet and physical activity and education environment. This will be covering the primary care and secondary care and technical education as well. 2016 is published the physical activity guide, like I mentioned, with recommendations for teenagers and children, incorporated within what is can be worked in the educational access. Finally, 2018, by a decree, it is created Consejo Nacional Honorario, coordinating policies on overweight and obesity with many different work lines. One of the work lines, it is based on this mentioning this work regarding the educational environment and other activities related to physical activity, which is secondary. There is a type of weekly activity for the first years. We have federate sports, we have federate sports, which we call it Vamos Equipo, national sports games. We do that through the Secretary of Sports. We also have Polideportivos with its ANAP, different physical activities in those programs, and in other cases from the National Secretariat of Sports, and sometimes the sports secretary manage those games and matches. And then there's a program also called Entreno y Estudio, training and studying, which is more younger people, not to be disconnected from the educational system, and also to keep their full cycle with studying and practicing activities. And lastly, we have the INEFAP, which is a commission to follow up on the law 1940. The 7 practices on that we'll be covering a little further. So it is created this law 1940 mentioned here, destined to foster what is healthy diet and physical activity in the educational environment. This commission is integrated by MSP, MSC, ANAP, and S&D, and is receiving support from different bodies like UNICEF, FAO, and CHSCV. The work plan of this commission, on the one hand, was to foster healthy, sensitize them to with healthy canteens, and thirdly, the practice of healthy food and physical activity that is measurable and assessed. Within component number 1, we drafted technical criteria to regulate selling food and drinks in the primary and secondary educational centers. We had a list of the recommended food. We had decodification of law in a plain language, in plain English. We fulfill the law. When we're visiting the canteens, we verify the canteens to see if there is any promotion of food or healthy promotion of food. We did some training as well for our professionals working on these canteens. We also drafted an audiovisual material together with the administrative part to finance, to file for this content on healthier food for these people who are handling food in this educational centers in primary care and the secondary care. So this food handling programs is very important, especially integrating nutritionists, especially in the component 2. This project, which we call is called like Prontos Listos Ya, was actually 2016 or 17, which was a project that would go in this line of awareness for the responsibles of the institute in terms of healthy diet and physical activities. And component 3, we had the guidelines to practice healthy food and physical activity with support of UNICEF with 7 practices to be developed in educational centers, and that in fact really was implemented. 1 or 2 of those practices in great part of this educational centers. Here we have some links to show you these 7 practices. You can see many of them are related to food. 2 of them also related to physical activities. Because of COVID, like we all know here, we can see the matter also of schools who were closed for some time. It was necessary to decrease these practices, the 7 practices in many institutions, in schools, in liceos, as well as in the high schools with a technical school that we have here. Well, I'll be sharing this link with
Estos son, que ya
you.
los
You can
mencioné,
check that out to see those publications. This was already mentioned. School environments and these entities working with us in these educational environments. These are the entities working together with us. So 2018, we had a decree which put in its highlighted where the saying those food excess of sugar or saturated fat, they have to be identified in their visible label. And with that, we can see that it was necessary to law to be changed, amended, and in place of these products that were not healthy products, they had to describe, they had a visible description, actually, in place of that visibility, they are banned in those canteens to use them in their secondary care and technical team. Because why? Because in those environments, in this age range, many more problems in the intake of those teenagers where they are in these diners where they have to have this school regulation in their canteens for healthier food. This is National Council. I mentioned before, National Honorary Council speaking on the different work lines to decrease the matter of problems of obesity in Uruguay, as we mentioned. This has to do with what we are working on, the educational centers. Now moving on to another item, we will be mentioning a little bit of what would be surveillance in Uruguay. As in any other country, we have a very severe problem on obesity or overweight. We have here some numbers, but I did not bring them to you because I wanted to be brief, but it is a public health problem, public health issue in Uruguay and around the world. Before, in regards to this matter of physical activity, which is a factor that would be quite important to deal with this matter of obesity in Uruguay, regarding to the surveillance and monitoring. We're counting on the research and steps that we call it in Uruguay. Encuesta Nacional de Factores de Encuesta Mundial de Factores No Transmisibles, which would be National Survey of Risk Factors of Non-Communicable Diseases, called in French. And we have also research, what we call them national surveys for students. And what are the characteristics related to physical activities that we are dealing on these surveys regards to the infant, the steps we have around 2006 and 2013. We held many surveys where we saw the comparative effects that would be of groups of 25 to 64, where we see for 10 years now this research conducted, we see possibly a in the year 2003, possibly these researches are expensive. We are conducting them in different places, and those countries that are conducting them, they don't know that they have to be done in different steps, specifically in 2 steps. So it's measured through a survey, the small consumption, the level of physical activity, healthy diet or non-healthy diet. We also measured this part. And on top of that, we also have through some step advice called steps. We take step 1, step 2. We see the obesity rate. We also see the blood pressure and also other factors. And in another level, we also measure through, we have a collect some blood and see glycemia and cholesterol. These are the steps. So as for physical activity, you can see that we're measuring through a survey. So we have more objective measurements through visibility of the physical activity. But in other moments, research brings us as if it was questionnaire in a questionnaire. That is, we have what we call it DIPA, which is a survey that asks measures physical activities with 15 questions, different environments. That is, we ask people the activity they're conducting in their free time, on the physical activity they're conducting in their work, and how they do this kind of change. That is how much time they use for each sphere, for each activity. We made an estimate that these max, as we call it, is about the research where people are active or inactive in regards to physical activity, if they have sedentarism or not. So like we said before, these are 2 different perspectives in regards to physical activity and in regards to what would be sedentary people. On the other hand, this AMSE, which would be GSHS, these are researches done with students 3 to 17, then we conducted in 2016, 18 and 19, 2006 and 12, at a population 3 to 15, and now 13 to 15, and now we are conducting with 13 to 17. And in regards to this levels of comparison, we are using these age groups to have this parallel. Therefore, these activities, these researches are done with questionnaires with the students, and they are answering questions. Here we have just 2 tables to see the situation that we are in. There was an improvement as far as physical inactivity, a decrease in the prevalence of physical inactivity, 2013 in regards to 2006, from 29.9 and 22.8 from physical inactivity. So similar number to what is presented was presented Dr. Luluseman at the beginning, which is 24% of the world population that doesn't meet recommendation of physical activity. And then we have the sedentary behavior that yes, there was an increase statistically. In summary, the healthy adult from Uruguay are more active, but they are more sedentary as well. What we noticed in this people that from 13 to 15, what has to do with the physical activity, unfortunately, we see a decrease of the prevalence of physical activity, a decrease that is statistically meaningful in regards to sedentary behavior. It's also, there is an increase if we look 2006 compared to 2019. In short, teenagers are less active and more sedentary. I don't have other tables showing you what is the situation like between the men and women, but as mentioned also Dr. Wilson, I think she did it before, we see that women, they're less active physically than men. And in regards to sedentary behaviors, we see both, if we look at adults or teenagers, similar to both men and women. Lastly, we're basically ready to publish in Uruguay. We have what called the Health National Objectives 2013. And now we're getting back to that, those the sanitary objectives health goals for the year 2030. And these objectives are included certainly what it has to do with the physical activity and to reduce the sedentary behavior. This has to do with physical activity in the strategic objective 1, which says that it's to foster lifestyles and health environments and to reduce risk factors. In the expected result, this one we have expected result, which is to increase the level of physical activity and to reduce sedentary behavior in Uruguayan population. What is the goal that we're using? We mentioned also by Dr. Williamson. This is one of the goals that has to do with the WHO, which is to reduce in 50% the prevalence of physical activity in the general population for 2030. In the case of Uruguay, what will be our baseline? Will be Encuesta Steps 2013, because we don't have the inferent step survey that we have. Then we want to reduce that for 15% in 2030. In the intervention proposals, we have intervention area number 1 was to promote and foster physical activity and reduce sedentary behavior because we have other factors. And then lines of action basically is what is recommended by the program, so on and so forth of OMS, to draft and update guides and protocols to foster physical activity and reduce sedentary behaviors in educational surroundings. We saw the lot on that. Also to foster physical activity and reduce sedentary behaviors in community environments as well. To foster physical activity and reduce sedentary behaviors in work environments, and to the other hand, develop communication campaigns to promote physical activity. Today at the beginning, we saw the Best Buys, and this, the Best Buy in regards to physical activity is a matter of developing communication campaigns to promote physical activity. We have this in an action line in our goals in 2030, and the other to work with governments and departments in promoting this. That is to keep on working, whether walking or riding a bike. We have to foster this activity. So that's all. I believe that I'm in time, and I'm here for you to answer any questions, to keep an exchange. I'd like just to present Luis, to introduce you, Luis. And share you my screen here. Mr. Luis. He's very tall. We cannot see him on the screen properly. He's very tall.
Muchas gracias,
Thank
Daniel.
you, Daniel, for your participation. I'd like to say that the program Actividad Física y Salud, it's a new program, relatively new. We are really working on this, developing a lot in those non-communicable diseases, but we are working together and we are developing programs to be able then to get to the physical activities. So we want to inform a little bit of what we're doing, and we are available for you as well. Our contact information for more communication. Thank you.
Muito obrigado, Maria Rodrigues.
Thank you, Maria Rodriguez, Luis, first off, for accepting this invitation by the Ministry of Health in Brazil. I think it's a very important moment to exchange experiences. I just saw here in our chat, a lot of people are making those comments about knowing what you do, that we can be advancing what level the countries are in regards to promote physical health, physical activity. I ask you to wait because we have some questions for you after this session. Next up, let me invite our friend from Argentina, Matias Abal. Matias is coordinator of the national program to fight against sedentarism of the Ministry of Health in Argentina. Matias will have the support by Dr. Argaya, who will show Matias' slides. Matias Argaya will be sharing here your slides. Now I pass the floor over to you. Thank you for your presence. Good morning. Obrigado, Daniel, for your presentation. Thank you, Daniel, for this international conference. As well, I'd like to thank also the possibility from Argentina. We can also share with you some of the policies that we got this far to promote physical activity and to reduce sedentarism. I believe that to carry out these policies, it is essential to have a support of the government. And thank God in the last years, we have a follow-up, a strong support also from our Ministry of Health so that everything relating to promoting physical health and to fight sedentarism. One of the most important points that we are working on the last year is the national strategy on health environments, which is programmed by the Ministry, Health Ministry, and this. If you want her to go to the next slide, just let us know, okay? What is it?
La siguiente.
Próxima slide. Next slide. Next slide. Next slide.
Aquí.
Here you are. Okay, so everything that has to do with the strategies of health environments, school environments, it's important to show you some of the laws that are following or starting this transformation, this promotion of physical activity and sports, both in educational system as well as the general population. There's a law 22,520 by the Education Ministry of the nation of Argentina, stating the mandatory physical education and school education in all school levels. Other laws that are very important are the national games, national sports, Evita, which are participating in 24 provinces in our country in the school age. That is essential to hold this program, these games, to develop both physically and socially in each one of the students and alumni. One of the laws, the recent laws, is a national law, 2797 by 2015, which is the law to fight sedentarism, which is a law sanctioned, but in our country still it's not regulated. We are working on it. And we want by next year it works and to be regulated. Something that this last law states on around 5 years before pandemics has to do about limiting time dedicated to sedentarism. Above all, the same thing that we're doing today, which is very productive because it allows us to communicating, but also many times where sedentarism behavior is sitting down very much, but we want to limit the excessive use of the networks of social media. Next, please. Here we'll be speaking about the standardization in school environments. We have 5 points. More specifically, we'll be covering one by one. First is to guarantee proper amount and quality of physical activity in the school environment. Second is to promote physical activity in the extra school environment. Third is to promote a inclusive focus to develop physical activities in children and adolescents. Fourth is to foster teachers training. And fifth point is to guarantee facilities, equipment, hardware, resources to reach development of physical activity in every activity. Next slide, please. And then we'll be covering the first point, which is to guarantee a proper quantity and quality of physical activity. We call that areas, space, and our activities, curricular activities that we find in school, for example, just for PE training, a facility which is a articulation with other areas, not just on physical education, but also for arts, music, food, any kind of subjects can be active. Next up, next slide, we have to see about the extra school activities. We foster what we call it active recreation, where there are rooms where boys and girls can conduct any kind of activities on the move. Of course, always being a safe space with a certain control, but we want essentially for this space, we call it recreation, to be made, to be on the go, on the move. We believe that any kind of movement, any kind of motion increases physical activity. That is, any movement is essential to get this habit going on for people to move, to be on the go. Another proposal that are interesting as well, it is the matter of active transportation, to use the people to go on bikes, ride a bike, or go to school walking, even with parents or on their own. Something that is also very interesting, everything that has to do with camping, sports, tournaments, both physically and socially, they can be developed. The next slide, it is the one to promote physical activity in extra school environment. Here we're working on very strongly with the clubs, social clubs, sports clubs for boys and girls to go to school and to have those PE classes, and also a school place they can conduct any kind of physical activity, specifically whether football or hockey, athletics, any kind of sports that would be interesting for boys and girls. It's essential to have this articulation, that is for them to go out and to have an opportunity to practice any kind of sport, whatever they're important to develop socially and physically, so that in turn also to have this habit of conducting physical activities, not just to leave school and to be sitting down in a computer or watching TV, but having a healthy habit, really pick up this healthy habit of saying, okay, after school, then I have my time, one hour and a half of football or athletics. I think it's essential to develop everyone, as like I said, to get this for the future, to any kind of non-communicable diseases, avoid those non-communicable diseases, not for not having physical activities. Then we continue here. The next slide, point 3, which is to promote the focus on diversity for development of physical activities in children and adolescents, and then we see teenagers, and then we see here even people with disabilities, or the matter of genders or sex, and minority groups. We want to have equality in quantity and quality of content. Also fostering flexible curriculum, adaptive to each person with their characteristics. We also have infrastructure and proper material and resources to fulfill these policies. Something essential are the training and capacity of our teachers and professors. They will be up to date day by day with something that is very important, which is, for example, to promote all the activities, proper clothing, proper attires. Many times they, especially in the school environment, they don't have the proper clothes, sneakers, or they're having trousers or pants, and that doesn't really lure them to physical activities. They don't feel like playing. They don't have proper attire, proper clothing, so they need to have those PE uniforms to be used on a daily basis every time they go to practice. And also another point is not to have a sanction to the movement, to be deprived from the movement, but to be this practice of physical activity to be really conducted regularly. So we're looking also with this physical activity to foster and to empower these strong points of individuals, to include the matter of respect, because when having those activities for every boy or girl, this is essential for us to repeat, always reinforcing that everyone, they have rights for physical activities. Next up, I said about fostering teachers training. We have in this training 3 steps, 3 levels, so to speak. Initial training, just teachings for all that has to do with the problem of facilitating school that facilitates having all the toolkits for him to fulfill his practices, to conduct his classes, and also the PE teachers that have a matter of physical activity and health, boys and girls and teenagers, and to explain how to find pleasure, really to be pleased and to be active in conducting activities to cause pleasure when exercising. After a couple hours, we're in a sedentary position. Our body needs to move, right? So, and then we have some continued training, which has to do with the postgraduates in priority access, and also the matter of scoring for each one of those who are going through capacity building or training. And lastly, the journey, the teacher's journey, where we have had talks with all the promotion on their own background, and their journey of being trained, the matter of food intake, the matter of respect, values. These are also essential in their growth. Next up, let's get to the last point, which has to do with guaranteeing proper facilities, proper equipment, and resources to develop the physical activities with quality. What do we want to say with that? We have to have safe spaces and accessible, both on and in school. The matter of distance or accessibility in school. That in the school we may have proper spaces to conduct physical activities in a safe way, but also for they can get there on their bikes or walking with no kind of obstacles or hindrances other than just climate, for example, that may change. Because if it's raining, of course, they go by car, so we can adapt them for the different possibilities of going by bike that can be safe. For that, we need to have an articulation, not just yourselves in the health ministry, but also has to do with the sports ministry, the public transportation ministry, for have safe streets, lighting, all the matter of signs, not to avoid any kind of accident in the transportation in case of going by bike or school or walking. And also, we have to have in each school, we're looking for them to have accessibility in terms of people with who are handicapped, because it's a school for everyone. So we have to have really a fact for every individual to be able to get in, get out without any kind of difficulties or hindrances. The next step, now we're going to the matter of our surroundings, certification of health universities. Here we're seeking different access which are essential for adults or above 8. You're looking now certain specific actions destined to reduce sedentarism and to increase physical activity in the student's journey at the university, looking to have actions to make them aware on the importance of how that impacts his own body today, but above all in the future as well, that can be reproduced and be widespread to all his surroundings. Because in reality, many times what happens is has to do with the much discussion and foods that are not healthy, and it is quite important the mouth to mouth where, oh, I do that, I have to train this or that, they have to come, and then adds up to one or the other, and then they don't think that they need to have some sort of investments. As for the word of mouth or media, but we have just to look for to have individual awareness for the individuals to do it collectively in a larger scale. Also, this is one essential thing also to conduct that for physical supports that allow to conduct a certain physical activity, and in the venues, many times in universities, they already have their own activities that work very well. It has to do with sports. So also we're seeking to get in the universities in the sports department to cause actions in which we're seeking to get rid of sedentarism. Now let us get to the one more slide. I'll show you what we're conducting specifically in the Ministry of Health in Argentina. In our building, by a position of the ministry, we conducted a space destined to active pauses for the staff on the ministry, have a venue which we were designing for many years of having in the building a space with a lot of people, and we would have to have a place for them, for the employees, instead of not having to get out of the building to go to a healthy gymnasium, something, then what we looked is to have this place, this venue for us to get close to us and we can work out. We have treadmills, bikes, and what we are looking is to around 15 minutes or 30 minutes of your activity, and then you conduct your activity, pause, and then you go and work out.
So it is important to generate those cultural movements. So there is a great adaptation, and many people are adhering to this in the ministry, and they are adhering to these activities, and that is what we want. We want to disclose that and communicate that, and so each public ministry will have this own space for this kind of activity, and this will be done with agreements with some gyms in order to keep going with those activities and those active pauses spaces. Um, and I believe that the pandemic will keep going with that, and those spaces will become a reality. And there is a lot that has happened during these last 2 years virtually. And I think, of course, this is paramount to have those active pauses, and those might be 10 minutes, 15, and just some stretching and some pauses. We have a bank in the country for active pauses, just like each province will demand, with videos and pictures with actions, and these can be shared with institutions so that I can send that to you. This is very productive and very reproducible, and so that the world, in the world that we are now, I think that is this is good for the body and the mind. And I think after so much time that we spent sitting down, I think spending 10-15 minutes on foot and then stretching and then returning to our labor activities as normal, that I think that has a lot to add to it. So the ministry has carried that over, and I, for myself, as a user of the space, I think and of this program as well, I think I'm very happy to be part of this, and the about the positive outcomes that we have both in the consultation and also in the ministry to generate that space. Let's start with the next one, and Dana will speak about the strategies for promotion in the first level. And with the following slide. And here we are. I think we will have this strategy for the practice. I think we have a recommendation, and then we have a chapter with the practice. And here we have the practice, the practical guide for diabetes, and we have the practice for obesity, and it is fundamental that each person will have their own chapter for each situation, considering that all of those topics will be related to the practice and the providing of such activities. Let's follow to the next slide about the courses and the virtual training courses here, specifically for the connectivity and the time that we spend with, in front of the screen. And of course, the reality is that on the one hand, we have had the good parts of it, being connected and doing things that we could not do physically before. And this will be good for resources and much more accessible to take these courses virtually. It's easier than in person. So with this kind of resources, we might have more people taking part in this with a more quick access. And we have two courses now. In particular, one is for self-management of non-communicable diseases, and the other one will be about the integral approach of non-communicable diseases, and this is the first level of intervention. And the next one is also speaking about the courses and training and virtual training courses that we have. And we have 3 specific courses about physical activities, and it has to be with the promotion of physical activity in health. This is a manual that will it has been used for many years now, and it doesn't have a new edition. It has the edition from 2015, and there are many things that we can use positively, and we have to update it still and bring in new contents and information. And it is depending on the decision of the national director. So we are working in order to carry out this update that I believe will be ready in the next year. And we are also working with a chapter that is about the physical activity and the promotion of health, which will be deployed throughout the country for each one of the rooms, for hospitals in each establishment, so each facility. So this will be a short manual with distinct topics related to health and physical activity. And to finish, we'll have the chapter about the prescription of exercise, and this is to be the manual for integrating the non-communicable diseases. So the next slide will show that we have 2 apps going. We have done one about the approach about the non-communicable diseases and the integral comprehensive management of those, and that is a very interesting app which brings in 2 aspects of the technicalities and then the concept, and then we have the application of some physical activity and the recommendations and how long should each activity last, and what kind of activities should we take in order to service specific patients. And we also have some active pauses and videos so that everybody can take part in that from home, and this is the application of those videos, and they last for 10-15 minutes each, and then people can take that from home and follow along, so they don't have to leave in order to perform their activities. And to finish, I think there's something that we can see in the last 2 slides, which has to do with the subject that we have been working with now, and this has been done by the director and the minister that is been working for the delivery of the first equipment for promotion of physical activity that is being delivered now. And I think many countries are also doing this now, and this is something that we use a lot throughout the country. Not only we are delivering that, but we also are deploying it for each province in order to incentivize physical activity. Also for different physical capacities, and where we have the articulation with other ministries in order to assure the access and security, and to assure lighting for these spaces, the public spaces where these take place, and they have a high transit of people. So these are specifically the ones you can see in the slide right now, and also in the following slide. This has to do specifically with the equipment that is used for wheelchair users, so that they can also have access to exercise. And each one of those equipments is millimetrically thought out in order to and adapted to each one of those users that can be implemented. So they can be used in these projects to be carried out by each country and each province, so they can each manage their own project according to the impact of the population that they might reach. And in the study, we can approve or according to the cost of installation for each one of those devices. And I think we do believe that this will be a plus for people with different capacities. Well, thank you so much for the time and for the invitation. Thank you very much, Matias, for your presentation and for the strategies that you have carrying out over in Argentina. I invite you also to wait a little bit because you also have some questions on the chat box. And we are going to invite our next representative from Peru, Nestor Guejas. Nestor is a specialist in promotion of health in the Ministry of Health over in Peru. He's also the vice president of the Peruvian Institute of Sports. So Nestor, we really appreciate you being here and accepting the invitation. And we are now going to hear from you so that you can know more about what's going on over in Peru. Thank you very much. Good morning to all of you. It's a pleasure to be here and speaking about Peru. Well, in my background, you can see that we have the National Stadium here. We have the Institute for Sports, and our stadium is a symbol, and this is where we have more activity in sports going on and health. And this is the maximum expression of it. So I'm going to share with you this presentation that I have right now. I have prepared that with a lot of care that shows the physical activity and the promotion of physical activity in Peru. Right now, we find ourselves not only with some success cases, but also with difficulties, limitations, and challenges that that force us to keep struggling with in order to be successful with those as well. So, as I said, with the promotion of physical activity, we have developed that multi-sectorial policy for 2030. The title is Peru, a Healthy Country. This expresses a few of the directives that we want to obtain from that analysis that have been carried out about the Peruvian situation at this moment by the ministry, and it has to do with physical activity, and we are trying to promote healthy lifestyles and behaviors now. And the second policy that we also approved for 2022 is the national policies for recreation, sport, and physical education. So in this policy, we understand that the analysis and the diagnosis that have been found during this national research about how the country manifests itself and how it manifests right now, only 6% of the Peruvian population is regularly taking physical activity, about 5 minutes a week. So we have decreased that. We had about 33%. That was the last measure that we had before the pandemic. And the legislation that is promoting and stimulating bikes as the means for sustainable transportation has also, I can say, this legislation somehow contributed to the increase of the use of bikes in Peru in the last few years. It is supported by the policies and this focus. So we are presenting what we are doing for the health sector in the first level of primary care and also in the national level, and also with the national and subnational level of policies. And we are also having communication with other sectors and other institutions in the states. And we are going to present some of the results that we have had during for these policies so far. As I said, the national policy for physical activity, recreation and sport and physical education, we had as a challenge for 2030 to reach up to 50% of the active population, which now is on 26%, and we have to double it almost in terms of physical activities in Peru and throughout society and with all of the conditions of the population. So we do have 4 objectives for this policy. So we have to increment the regular practice of physical activities. And the second objective is to develop competences and education for an active life and healthy life. And then the third objective is to develop competences for the professionals of physical education, not only to take part in the physical activities, but also to as we had on the last few decades, since the 80s, we have a lot of growth of this area because the professors and teachers of physical education would only give a ball to students and then they would leave them there in order to see the improvement of exercises. And this has motivated us to have it the disappearance of physical education. And since the early 2000s, we have started to have that back, and now we have a national policy for the Ministry of Education with physical education, so that we can value our professionals more and more. And with that, we are managing to have the professors not only to develop the competences, but also to support the and foster the behavior of healthy habits, and also with good food and nutrition, and also physical activities, and also to increment the development of high competence sport activities. So lastly, we have also the legislation that promotes and regulates the use of bikes as a sustainable means for transportation. Here we have the adequation of the infrastructure, the physical infrastructure for bikes, and I believe the structure is also sustainable, so that we can increment the bikeways and also the buildup of tracks all over the country, so that we can have the intermodal transportation, so that in a single public lane we can have cars and motorbikes and public transportation and bicycles as well. And parking for bikes in the business environments and also in the business districts of the towns, and we have a percentage of those spaces for bicycles as well, and also a public bicycle system that we have implemented in many districts, as you can see in this picture. And of course, as results, there is a program in the Ministry of Finance and Economy that tries to create a budget in order to reach specific results. So we still have two budgetary programs which the state is going to work with in order to transfer money for subnational governments, as we have here in the subnational representation of the health ministry, with two programs for budget transfers. So one is the one is 018, which has one of the components to promote physical activity so that the population can be assisted in terms of physical activity. And the other one has to do with the increase of the physical and sports activities and recreation in the Peruvian population. And this budgetary program is carried by the municipalities. And here we have the possibility not only of incrementing the knowledge that we have, but also generating infrastructure and spaces for recreation, parks, stages, and also and bicycle paths and other public devices. And the promotion of physical activity in the system, in the health system. And for the health personnel, healthcare providers, we can also have spaces so that they can carry over with their physical activities. We have the budget available so that the health staff can also take part in those activities for education in the population and generate inclusion with that, with the topic of physical activities in these campaigns, serving the community with the social communication and establishment of health activities and alliances to promote such activities with the community. So that's why the healthcare establishments can have a subscription so that they can be counted as hubs, so that the population can join them and take part in these activities with the healthcare professionals during the labor hours. So this subscription system to promote physical activity should be considered under four aspects: the institutional aspect, which is the from the point of view of operation and institution, has to be included in the flow chart to show how this physical activity is going to be stimulated. The academic aspect should be taken into account as well. The curricula should be considered so that from the school curriculum itself, you should be counting with physical activity. In the national curriculum, we have that, but we have to adapt it to each one of the institutions in the many different spaces we have in the countries. That's why the Ministry of Health should invest in doing pressure to include that in the norms for this level of service providing. In the aspect of the facilitator, we have to create infrastructure so that the municipal government and the federal government can also communicate and create those infrastructures so that the facilities can also allow for people to take part in physical activities. And we understand that we also have education programs for basic education school and also higher education and institutes, universities, and of course to the community in general in terms of supplying community work. We have a technical document from 2015, a document called Management for the Promotion of Physical Activity. Here we have the main strategies and the management of the sectors of and the communication between sectors about how to deal with other sectors that will promote physical activities. And here we have some recommendations according to the cost and the age group and other kinds of interventions that we can have according to the setup and the background of each population. And there we have some initiatives and according to also these scenarios of in terms of labor and income and the context, regional context that people find themselves in. And with all of those, we try to promote physical activity. And we also have some recommendations for each ministry according to their own competence, so that they can also take into account the physical activity so that they contribute and facilitate the activity for the population. So, for instance, we have communication plans so that we can convince people to use also other kinds of vehicles, not only motorized vehicles, so that they consider, of course, the priority of physical education. And the Ministry of Education in their own jurisdiction can promote physical activity in schools, so that each ministry will have the role to play according to the needs that we have for physical activity, so that they can also organize themselves to talk to the population. In terms of training, we this year had a priority to carry out some trainings for professors and teachers, school teachers. So far, we had about 60,000 professors trained in the promotion of physical activities, 568 healthcare professionals trained in the prescription of physical activities. We started this year, and in the last few years, we didn't have that due to the situation we had, of course. And we have more than 3,300 municipal workers and more than 16,000 community leaders, and that goes for mayors and other leaders that have been trained in order to incentivize physical activity in the population, and more than 30 managers, specialists in promotion of public health in the subnational levels according to each region of the country, so that they can promote the course to promote healthy habits and also healthy nutrition and physical activity. And this is a training that takes place for the population in the Amazon, the Peruvian Amazon region, and also with in partnership with local institutions. So we have the Parts Initiative in Peru up to 2021. We now reached in the second phase of the subnational development of this initiative, and we have those sub regions with those numbers of urban areas that have been reached. So we are with about 208 health establishments that are developed so far. Now we want to develop 25 more in order to reach 102,000 people. So here we are considering fostering physical activity as a healthy lifestyle And these have been developed by the for the entire population in those regions with a higher priority for those who need the most. And that is the life depending condition of the population that had this intervention before, and they have some infirmity or some comorbidity that they might have due to their habits, and they have to change those habits and acquire new habits. So that's why we have focused in the physical activity and nutrition with this population, such as hypertense and diabetic population. So we have the vial infrastructure that is being adapted to increment the infrastructure for bike paths and increase the availability of cycling ways, and this has been done with support of budget, with the implementation of systems for sustainable transport without motors. So this is the recommendation and the measures that we had for how a bicycle lane should behave. And last year, of the 1% of the population that would use bicycles in the city of Lima, uh, just 1% of all of the 4% of the population that would use bikes in Lima would use the bicycle lanes. And now we have 4% of those. So we increased in 3 points, 3% points during the pandemic. So regardless, we have to have short plans in order to deal with these population right now. But we are now reaching the 14% of people who are either walking or using bicycles to go to work now in Lima. And so this is a good outcome. And more than 300 kilometers of bicycle lanes that have been created in the last 5 years, while we carry over with those studies in the national level. That is for Lima only. And we have the Ministry of Sports, which are creating this sport program called the Top Muni program. And this program counts on 174 municipalities that have been registered to the program in the country, and that is 70% of municipalities throughout the country. However, these municipalities are the biggest, and they are especially with the highest amount of people who are taking part in these programs are people with obesity or excess weight. And those are places where we have rural areas, and you don't have any ways to build bicycle lanes, and those are more huge. For those urban areas, we have higher numbers of population taking part, and 40% of those regions have municipal civil servants taking part in the program, and 150 companies have been financing those facilities. And thanks to this Top Muni program, we are going to benefit more than 340,000 people. And in terms of education, the physical activity is for education. We have considered the national curriculum for children from 0 to 5 years of age, and also in terms of this is the increase of psychomotricity, and these people have been prepared for physical activity and physical action. So we have these subjects in the school for physical education, and we are taking into account 3 hours of physical education a week. In 2017, we have only used 2 hours of physical education a week, and we increased that into 3 hours. And recently we started with the National Plan for Physical Activity that I mentioned a few slides back, and we managed to make it mandatory for all schools to have children take at least 10 minutes a day of physical activity, and also with some sports competition in schools. So it seems like the South American Games would happen in Brasilia. They have happened in Brasilia, and now they're going to have in Paraguay. And we also have the floral games in schools, such as games and dance competitions, and they really demand on the physical conditions, and that's why they are considered to be part of these projects. And the university school games, uh, all of the universities in the country will take part in them, and also uh, the solidary ways. This is a program, Via Solidarias is a program that is taking place in the rural areas so that people can go to school, and sometimes they take up to 2 hours to go to school. So the state and the Ministry of Education has offered bikes so that the children can go to school in the rural areas using it and go to school and back home with a safer and with safety and with a non-motorized vehicle. We also have a policy that works in Lima and other capitals, in the main capitals of Peru, in the main provinces. It has to do with the Sunday without a car. So we created cycleways, and this is this is in Arequipa, which would be the equivalent to Avenida Paulista in São Paulo, Brazil, or La Carrera in Colombia. And this is like the Times Square of Lima. So last year we had 398,000 people cycling in this cycling path throughout Lima, and 532,000 people have been using it recently. And in the 22nd of September, we opened another one. We can see that in the left-hand side. This is the Brazil Avenue. This is a long avenue, and this is a wide lane. And on Sunday, it is closed so that people can walk in it and also uh, use their bicycles. This is used in the capital in Lima, and sometimes you have the prohibition of automobiles. So usually you can only go to the historic center walking or using bicycles or non-motorized vehicles, and this is used usually in the last Sunday for each month. And the downtown historical center can also be visited like that. And we also have a policy for every Sunday. We have the Academy for urban cycling. That is the right hand side picture. It shows with instructors teaching the general population of how to use the bicycle and how to use it in the public ways, not only in the cycling paths, but also amidst traffic, and also how to protect yourself from cars, and also the mechanic part of the bicycle itself, so that people can make their own upkeep of their own bicycles and how to keep it going and working properly. And we also have the Actimóvil, which is the sport truck, which now we have two of them. This is one of them. This is for promotion of sports. This is the left-hand side picture, shows the instructors. They are personal trainers that will teach and challenge the population to take part in physical activities. And we have many elements and sport materials here so that the population can take part in that. And that will stimulate the population. And here we have on the right hand the other truck giving support to the fight against obesity in Peru. And during specific days, they will use the truck to go on the city, and those two trucks will go to parks and markets and health fairs and specific events and venues such as marathons and bicycling events, so that they will motivate people to not only teach people how to move, but also giving people general messages about health and the healthy lifestyles and healthy habits and healthy nutrition and topics that are priorities like that. And here we can see the health truck being in a rural area, and let's say in the outskirts of Lima. So this is this is one of those places where you have very few opportunities to see that. And here we have also a program that is called Activate Peru, which is the national program to Activate Peru. So this is the training movement for body and health. In Peru, we have this name because we have a number of internal issues, and this is an invitation to get more active. So this program is a strategy that is being successful in some of the regions to bring people together and make them think about that challenge, about how to be healthy. And this is where we have many instructors in this picture in the left-hand side, and they teach people how to stay active using aerobic movements. And in this other picture, you can see the other program with some labor gymnastics. So we also fostered that with the Activate Peru program. And here you can make people have more speed and more agility within this nutritional program that is taking place in the company, where the people who work there, for instance, this one, we have 225 workers in different institutions working with health, laboral health, and they become part of the program. So the objective is to make people improve their health indicators, so they will self-assess, and they can trace their own cardiac profile, their own health profile, and they will be more careful with their own health. So we also have some bonuses that we distribute to those workers who the healthcare workers who take part in that. So this is a bonus that is about 25 soles for a day for the person to go and take part in those activities and also to consume healthier food. And this, for the whole month, it's about 750 soles, which is basically a bit less than 200, about $150. So that is what we get in order to improve the nutrition of our workers, and this is bringing new freedom and making people get healthier. So we have about 150 employers that take part in this. We want to reach 100% of those indicators for health, of course, and we will decrease weight and increase the lipidic profile, and of course transform using two actions: physical activity and healthy habits for food. That's what I wanted to share with you regarding the time, and I want to respect your time, and so I will be available for questions. Thank you. We really appreciate your time, Nestor, for showing us a little bit of the Peruvian experience in this first international conference for promotion physical activity in public health. Now we have a few minutes left, and I will, before we go through the Q&A, I have compiled some of the questions here, and I will have a round for each one of the countries. But I need to really thank the advisors for foreign relations here at the Ministry of Health. They have been in touch with many different countries, so thank you for that. And just to remind you, for you to get your certificates, you have to access the link and our website, and then you can access your certification. And this is also being broadcast using our YouTube channels for DataSUS in the Ministry of Health in Brazil, and also in the channel for the Pan American Health Organization, PAHO TV, in their YouTube channel. So I'm going to now ask the first question, and the first question will go to Marlene from Portugal. Marlene, we had a question regarding the resistance that you have here. I'm trying to translate those questions. Sometimes they are difficult to understand. So we have a very interesting program for advising in physical activity. So the question here is about the whether or not you have some resistance for professional categories, and how do you see that relationship between doctors and nurses, and how do you work over in Portugal with this relationship with teen professionals in order to promote physical activity? Well, thank you, Danielle. I appreciate the question. It's very interesting. Well, we managed to have data from the system. So since these tools are being integrated in the platform, in the digital platform for the specific healthcare appointments, we also have mentioned the primary care and primary health attendants. So we have monitoring that shows the specificity of each one of those tools. So people who use them the most are the doctors. Of course, they use that a lot. And among those, we have the doctors that monitor that, especially with accordance to their own specialty. In Brazil, that also happens, and other countries as well. So whoever is working with primary healthcare, we have that specialty, but also the nurses. The nurses are also giving a great support in those appointments, and sometimes they are the ones who are assessing the waist perimeter and arterial pressure, and we have the most use from those tools of those tools by the doctors and nurses, and we can, one of the things that we want to do is to migrate those platforms so that they can become accessible to even more healthcare professionals. So they are linked so that it is for everybody. We have a PEM that is only for the doctors, and we want to leave a PEM be by itself, but we also want to have that available in other platforms. So we also have these free downloads, but the downloads we cannot monitor, of course, because that is free for download for everybody. In our country, we don't have any conflict between the use between nurses and doctors. Actually, that has to do with the healthcare and how it is organized by appointments, and then we have the constant monitoring between nurses, and then you have the doctors coming in, and those, so you have some specialties that the nurses will carry out the most, and then the doctors will do some other things. Nutritionists will also do that. We wanted to, we believe that the main problem, I would like to hear Brazil about that, because I think we have some indicators about the assessment that are also updated, and the units will be using those assessment and keeping a register of those of whatever is happening in terms of glycemia and arterial pressure. And we want to do that with those indicators as well in order to increase their use, because that might be even greater. And of course, the Portuguese numbers, I was looking at the other countries, I was thinking, my God, we have the Portuguese map. They are such a tiny number, but we are really a tiny country, so that's why. And even in terms of the population expression, that is, and also the territory. But despite, I think we, even though we have those general tools, they can be and they should be used more and more, and they should be the routine for it. Just like somebody who goes to an appointment for primary health care, they should have their arterial pressure assessed, and also the weight and the physical activity, and that should be mandatory. And of course, that should be involuntary, that should be mandatory. I don't know if I answered the question. Very well, Maria. Thank you for your response. I think it's very interesting to consider those differences between those interprofessional relationships, of course. And the next question goes to Matias from Argentina. And Matias, I'll try to gather to join two questions here. The first one would be about the proposition for those pause spaces, those active pauses that you take. Do you have a proposition that might be systematizing that for other places as well, or do you have the monitoring for that? And the second question is about the equipment that you have for accessibility that you showed in the pictures. Do you have specific professionals in those locations to guide the activities, to guide people on how to use those equipments? Well, I understand the two questions perfectly. Thank you. Well, about those active pauses, actually, we have worked with that both in the Ministry of Health and in the ministries or subsecretariats for health for each provinces, each one of the provinces. So the idea in our case is to apply that to all of the subnational bodies. So we could also bring that to proportion to provide the or at least to advise all of those users and private initiatives as well to take part in that. And actually the majority and many companies are turning back to the in-person labor, of course, but many are not. And so we propose those active pauses, and they can use that virtually, and we are incentivizing people to do that in person as well. We can have that in the office, and also even if you don't have a space, a specific space for that, because not all offices will have a space dedicated to physical activities, but sometimes you can just go about sometime and do that. Specifically in the level of the states, we do have many entities which we manage to replicate that with, and for the private sector, we are just recommending them about how to do it. We cannot make it mandatory, of course. And about the track and the equipment that we have for those tracks, and the way we work with them is that in that case, the province will send us a project in which they will include the justification on how they and why they have requested such equipment, and the population density that might have some kind of disability. So in this case, that is specifically for wheelchair or people with seeing disabilities, and that would be assessed, and with that delivery, we would have something like a contract, quote unquote contract, between the municipality and the government, and the municipality or the province will have this commitment of keeping the production of the equipment, and also specific professionals to control the use of those devices, just like and also the safety of people who are using it. So what we do is to train those people who are going to be there with the fundamentals, and also the main characteristics of the technical aspects of it, so that they can have an idea of how to use those equipments, and of course to make it last a long time, because the idea is to have those equipments being used for a long while, not only for a month or 2 months. No, the idea is to have a full change of the lifestyle, so that they can use that safely, and so they don't have any injury from that. Thank you, Matias. Very explanatory. And the next question would go for Uruguay from Maria Rodriguez to Luis. You are producing a manual for prescription of exercise that is already in the construction phase now. And the question that we have is, how do you think about working with that manual? What is the target audience that you are working with for this manual? Well, this manual is still being designed. It is targeting the doctors, and we have the first part with the explanation of everything that we have mentioned in terms of physical activities, and the not only the physical activity, but also the exercises that we have to consider. And then for some areas, we will have the prescription and the thing, which will be the frequency of identity by according to time and the frequency they have been identified with according to the pathologies. And I have forgot to mention that the Commission for Cardiovascular Health this year, it isn't disclosed yet, but they made available in their website. They have the website that you can join, and then you can go there and join the discussion about that. You can go there and you will see some videos replicating different pathologies. So we started with this inclusion stage, but we still lack this work that we started and we have to advance, but that's why we call it prescription, because the doctor might be able to prescribe that just like they do with medication. So we have a long ways to go still in order to keep going in that sense. Thank you, Maria, for your explanation. I think that is very important to advance in order to create those protocols and to prescribe that. The next question goes to Nestor from Peru. And the question is about the national policy and intersectorial policy for health. So the question is, in this policy, how do you include the targets and the budget for these actions, and how do you monitor those from the health system? Does each ministry have their own specific budget? And that is the question about the budgetary aspect of this multi-sectorial policy. Well, yes, thank you. Effectively, we do have the objective of lowering up to 15% of the access of the excess weight, rather. And we want to make it coincide with the policy for promotion of physical activity. That would be to double the efforts for physical activity in the Peruvian population. And with that, in addition to that, we have each ministry with their own activity, having their own proposals so that they can bring specific targets and indicators so that they can add more and aggregate more. And with that, we also have the goal of having many aspects that are complementary to this policy. So we have mentioned some of the objectives that we had in order to promote physical activity in the Peruvian population, basically. So that's where we have to increase the quality of the services we provide to the population. Thank you. Thank you, Nestor. The last question goes to Fabiana from Brazil. And this question is related to her opinion. How do you assess the financial aspect of those incentives and practices of physical activity, both in the Academia da Saúde program and also the incentives for physical education, physical activities, and how do you evaluate those programs? Well, we have managed to increase with considerable speed, this financial aspect of promotion of health here in Brazil as a whole, and especially when we speak about promoting physical activity as well. So as we showed in this graphic, we had barely 2.5 million real invested, and in 2022 now we have the budget for 51 million that we are going to spend entirely. 100% of that budget is going to be used to pay for this monthly cost of the Academia da Saúde program. And as I said, this year those hubs had the bigger use, larger use of this monitoring budget. So we managed to pay for those hubs monthly. And regarding this kind of physical activity, we managed to have the budget of about 100 million real for 2022 and around 170 million real for 2023. So this is going to pay for the incentive of physical activity, all of those establishments. So if we compare with the previous years, we are going from, for example, from 2022 to 2023, we are going to almost have a 4 times more budget for physical activity, considering that we have that issue of the incentives that we mentioned during the presentation, not to mention the budget that we are using for promotion of physical activity to finance all of those partnerships and researches that we had mentioned before. That is a significantly lower amount, but those are a few million BRL, so that we have invested a lot more in the promotion of physical activity in Brazil. And that is essential to hire new professionals, to buy new material, and to build up new physical spaces. And this is considerable considering the supply of actions for physical activity. And mind you, in the unified health system in Brazil, we have one of the basis that we have is that we should use the budget of SUS as part coming from the federal level and part coming from the subnational level. So we have three parts, and we always struggle to have more budget in order to qualify more hubs and to register more establishments for health, just like the basic healthcare units and the basic units for riverine health, and so that we can supply more physical activity opportunities within the unified health system, in addition to those points that have been offered by other sectors. Thank you, Fabiana, for your explanation. We are now reaching the end of our first day. We only have to say thank you for the representation in Portugal with Marlene, the representation from Uruguay with Maria Rodriguez and Luis Guerre, the representation from Argentina by means of Matias, and the Peruvian representation also with Nestor Iejas. It has been a pleasure to have you here. I think 5 different experiences, and tomorrow we will have more. Our schedule for tomorrow will start at 9 a.m. Brazil time, and that will be showing the document for public policies with the analysis of governmental actions in general settings. And then we will have a talk from Leandro Garcia about the promotion of physical activities for the SDGs agenda. And tomorrow we will have even more countries. We will have 3 more countries. Initially, we will hear from Costa Rica, Paraguay, Chile, and then we will hear from Colombia, Jamaica, and Ecuador. So tomorrow we will have one day full of knowledge being shared, lots of fun to be had, and we're going to identify the strategies and actions and the policies that countries have been promoting for physical activity. And now we are finishing for today. I really appreciate you all being here with us, both in the website and on Zoom. So the certifications will be given via website, by means of the website, and the people who have been with us in the YouTube channels and DataSUS, Public Ministry of Health in Brazil, and also PAHO TV. So I would like to say thank you again to Juanes from the Juana from the World Health Organization for her opening remarks, and we have a meeting for tomorrow at the same time. So I see you tomorrow.